superficial aging factor. Balancing proportions and not overfilling. I do feel like whenever you are leaning towards the monotherapy approach, the balancing portion is difficult in a sense if we're not looking at the tissue anatomy as well as the health of it. Combining treatments equaling better outcomes. When you're able to do a little bit of everything in moderation, I do feel like things just look a lot more natural as well. And then leads to better outcomes. Customizing per patient anatomy and goals. I do feel like each ethnicity has its different features. The goal is not to put everybody in a cookie cutter I guess, where you have your golden ratios. I mean, it may be golden for one ethnicity, but maybe not for others. This is one of my clients here. This is her before photo in October last year. You can kind of see from her skin that her skin looks great. It's nice, bright, but she's came to me because she feels like she was just looking more tired, more heavy. My first initial treatment for her involved biostimulation, where I'm able to address some bone resorption, but also address some of her medial aspects as well. Her concern was her lower face heaviness. So with the Sculptra, I did put that on bone as well as the lateral aspects to create more of a lift for delayed gratification. But what I found is whenever you are treating with delayed gratification, people get underwhelmed while we're waiting for that collagen to kick in. So I do, in my practice, try to give more instant gratification in conjunction. So while they are improving, you are continuing to see better results over time. You can see the filler is placed in the mid face to give her eyes some support and the radius into her jawline for some collagen stimulation and structure. In her 1 month follow-up, you can already see her instant results where she is already seeing improvement. Her eyes look a lot well rested. If you look at her profile, you can kind of see her jawline's improved. She came back 5 months later and she's still improving, and I haven't touched her since. She looked like she got a little color, but you can see where she kind of has her bounce in her skin again. And look at the profile on the lower right side. You can see even her jawline's even more defined without me touching her. This is without any Dysport. This is all the filler and all the biostimulation, the radius doing its magic. Here is another patient of mine. June 2025 to April 2026, over the 10-month course. We did do baby steps. It doesn't necessarily mean you have to do all of that in one sitting. Over 10 months' time, I collaborated with my esthetician, Hunter at SkinRx, and he did microneedling with PDRN boosters. So you can kind of see the glowy skin, the tone texture is improved. She did her monthly custom facials. I did full face Dysport on her between this time period to give her a little bit more relaxation on tense muscles. I did PDGF under her eyes to kind of give her some nutrition in her eyes. Filler's not always the answer. Smooth threads around her perioral area and her laugh lines, and a little bit under her eyes. I did the Sculptra. Actually, I did that right in the scalp area to provide a little bit more lift to her eyes, to see if I can give her a brow lift a little bit more sustainable when it comes to the Dysport brow lift. I also did hyperdilate radius to her chin and chin shadow, and then Hunter finished her off with the Moxie. So overall, you can see over 10 months time, a little bit of everything can make such a huge difference in making you look refreshed. I have another client here. We did a combination therapy as well, filler, threads, lifting threads, full face Dysport, and some under eye salmon DNA. You can kind of see where my vectors are and where I lifted her. We definitely kind of flip that triangle upside down and kind of give her a little bit more of a lift, more slimming effect, more tapered look, more rested eyes. And that's 8 weeks later. So stay curious, invest in your education. You have to marry both science and artistry. Think of the whole picture. collaborate and don't compete. I do feel like it's important for you to be able to see the full picture, the full face, and even the full body. Consider wellness. I mean, aesthetics, we all kind of merge together, and it's important for us to work together. I refer out a lot to my estheticians and then also even to surgeons. It's important to know where your toolbox is, what optimal result you can get within your toolbox and what they can get outside of that toolbox. So stay learning.
Thank you, Kat. Thank you for your presentation. We have a question here. It is how often they need to do the treatments to maintain the skin healthy and don't overdo it.
I think it depends on the patient goals, but it also depends on how fast. I have clients who will see me twice a year and they will knock out all the treatments they can safely and then just see me twice a year. And then I also have clients who want to baby step things, whether it be due to beauty budget or downtime, and they'll see me once a month and do a little bit at a time. So I think it depends. Once we kind of get through the first year of investment, I always say you shift over to maintenance, and typically I try to see like twice a year, a little bit more frequently with neurotoxin, but yes.
Thank you very much, Kat. And the last question is about Botox. There is a patient who have they have resistance to the Botox or the toxina botulinic.
I'm sorry, I didn't catch that.
Is there is a patient who have resistance with the Botox, because just yesterday I have a new patient and she told me that she was doing for the third time Botox and she doesn't have a result.
Okay.
I don't know. She said that in the location where she did, they told them that she have a resistance for the Botox. I don't know. It was for me, it called my attention.
I do think that it depends. If a client is coming to you saying that they are resistant, you have to do your due diligence and figure out the whole history. Like, what provider did they go to? Do you know the provider? If you know that they will put enough units in, that's important too. What product placement, how much, because we know dosage duration. Those are the things as a provider we need to figure out. And honestly, we kind of have to explain to the patient that way. This is the reason why we don't hop from office to office, provider to provider, because we need to have a really good historian. We need to have a good history to figure out if this patient is truly resistant. Is it a matter of switching product? Is it a matter of changing the dose? Is it a matter of placement?
Okay. Thank you very much, guys. I appreciate your time. I'm just going
Yeah.
to continue with the program today. Enjoy the rest of the afternoon. Thank you.
Thank you.
Okay, following with the schedule, we have the next panel, and the next panel is the new generation of injectable science, safety, and facial harmonization. We're going to invite Amber Fossetter, Sara Toro Morales, and Valerie Rodriguez.
Hello, good afternoon.
Hi, Valerie. How are you?
Good, how are you?
We are waiting for Amber and Sara. Valerie, could you please introduce yourself? Valerie is psychology. Could you introduce yourself until the other two speakers are starting?
Yes, of course. Hi, everyone. My name is Valerie Rodriguez. I'm 23 years old. I recently graduated from Florida International University with my bachelor's in psychology. I'm also a model and an influencer on social media. And yeah, I'm very happy to be here surrounded with such professional people. And thank you so much, Idalis, for the opportunity.
Thank you for your time. I know that's the amazing part of Flora Interior Beauty. We can integrate new generation, the middle generation and also old generation. That's the idea, to learn from you guys the new information and how we can combine all the experience. So we are
Yeah.
waiting for a Sara Toro y for Amber. So let me see, 1 second. Sara is here. Sarah is here. Susie, could you help Sarah to put the cover? I think that she need that.
Hello, everyone. I am not able to set up my background yet, but yes, so grateful to be here.
Okay, we're going to help you now in a few, Sarah, no problem. Amber
Thank
is
you.
here. I think that Amber is here, Susie. Okay, 1 second. One second, Valerie, that we have to help Sarah with the background.
It's okay, no problem at all. In the meantime, can I congratulate Miss Kat because I really liked her presentation. And the part of consent and working with the anatomy of the patient, I loved it. It was really good.
Thank you. Thank you. We all need to work together, right?
Right, yes. An open collaboration is really good. The communication as well. Yeah.
Thank you.
Sarah, we have a problem with Sarah, you have to be without cover because there is no option now. It's okay, you can be without the cover. Okay. Okay, we can start now. All right, the first question, let's go to introduce Sarah because I couldn't hear you, Sarah, sorry. Could you introduce yourself first? No, I can hear you, yes, now
Can
it's
you
okay.
hear me now?
Yes, now.
Hi, everyone. My name is Sara Rios. I am a RN. I have the specialty in aesthetics nursing, and I've been dedicated these last years doing fillers, Botox, some threads, and biosimulators. And basically, I'm dedicated to the wellness world. I do IV therapies also, and I am an infusion nurse as well. Yeah, this is my profile.
Thank you, Sarah. Let's go to start with the questions. If Amber is not connecting, we can start. Okay, no problem. Okay, first question is going to be for Valerie. Okay, but Valerie, how can psychology improve, sorry, how can psychology improve patient resolve and safety?
How can psychology, I'm sorry?
How can psychology improve patients resolve anxiety?
And
Safety.
safety. Well, from my psychological perspective, it is very important to keep in mind that we need to have a process, right? First, we need to, like Kat said, collaborate between professionals. So with the estheticians, they need to see if the person is completely adapted and able to receive those type of treatments, right? And they need to have a psychological evaluation beforehand, so we can know that, hey, like this person does actually wants to have this treatment because they want it and they need it and they're going to feel better themselves, or if it is because of a body dysmorphia, if they want to look like somebody else. So we need to have that safety in preventing other type of how do we say it, like a confusion with themselves, so we can help them address the parts that they need improvement in and work with themselves so they can have the results that they actually want.
Thank you, Vale. Definitely, the psychology part is a big, big, and the most important complement in aesthetic patient. And I really admire your work because you recently started just literally from the university. But I told you, and last time I told you too, you was grow with your mom, that your mom have is a registered nurse too, and she have all the experience. So you grow with her, and you know all about aesthetics. So from long time ago, you right now you are doing the best complement in high level education in psychology. So I think that is really important. Sarah,
Thank you.
Sarah, question for you. What safety state matter most injectable treatment?
What is most what?
What safety state matter most important injectable treatment?
I'm sorry, can you repeat the question? I cannot hear you very well.
Okay. What safety state matter most injectable treatment?
Idalis, I don't get you.
No? Okay. Okay. Can I do in Spanish? No, it's okay. Again, what state are affecting in the most injectable treatment? Now? Can you?
No, no. Can you?
Okay. So I can type you. Oh, I can do that. How do you balance natural result with patient expectation?
Okay. I think this is crucial in every treatment that I offer the communication process with the patient. Uh, a deep evaluation along with this educational process is very important to emphasize that injectables are different from surgery, and patients has to understand that what are the expected results and limitation of the treatments. Uh, Even though our goal is to keep natural results, not all patients want natural results. At that point is something that we as a professional has to discuss with the patient, and that's why orientation is so important.
Thank you, Sarah. We continue with Valerie again. Valerie, how do you balance natural results with patient expectation?
How do we balance it? We need to balance it in a way that we can improve their own facial structure, because they might have expectations by watching something on social media that is not completely real. Because every time I see with my mom that they come with a picture of somebody else from Instagram and they have a complete different anatomy that is not going to look good on themselves. So it is important to work along with a psychologist and the expert, the esthetician expert, so we can achieve the natural result working with what I already have, with the natural facial structure of the patient that is coming to the office, right? And also telling them what's the truth. Hey, like you have this facial anatomy. Why do you want to do? What do you want to enhance on yourself? Do you really want to do this? And it's not about losing the patient, because we don't want to lose a patient. It's working with the right patient at the right time so they can have the natural results, and also we can avoid them having that dissatisfaction and asking for the money back, or then wanting it to get it dissolved, the product dissolved, which can result in us losing money, or the person. You guys always want the person to be happy with the results, because we're not doing this for ourselves, we're doing it for the people, for them to be happy with what we're doing, right? So yes, for the natural part, we need to work together so the person can be knowledgeable of themselves, of their facial structure, and also what they want to accomplish, so um, we can know what to make them happy, basically. Mhm.
Thank you, Vale. We have Amber here. Welcome, Amber. The question for Amber is, how do you stay ethical when meeting patient expectation?
What was that again?
How do you stay ethical while meeting patient expectation?
Oh, I'm meeting patient expectation.
Mhm.
Yeah, it's just a lot about the consultation process. It's super important. I feel like I teach a lot of new injectors about how important that consultation process is, and just setting the correct expectations, depending on the treatment, right? So what one syringe of filler is versus, full facial balancing with maybe multiple syringes, and what those outcomes can look like. Same thing with Botox or other, neurotoxins. That, for example, they might soften some lines, but not necessarily erase the lines and things like that. So really just kind of doing a lot of education, especially when I first consult with the patient, to make sure, their goals align with stuff that I'm able to do for them, and as well as, referring out if needed to, a plastic surgeon or other forms, depending on what's expected and what's needed. So I think a lot of that is just kind of building that trust with each patient, and really just, again, educating more so than anything, since we're the professional, kind of giving them our expertise, our recommendations, and then kind of coming up with a collaborative, treatment plan with the patient, I think is really important.
Thank you, Amber. That's the second question is going to be for Sarah. And Sarah, how you pre how do you do the education in the consultation to give them the real patient expectation?
I think Valerie touched like that point before, and it is to educate the patient how we can meet the patient expectations versus the treatment we are using versus the budget that the patient have, because some patients have unreal expectations. It's also important that she says already about the anatomy, about it's really like have the patient to understand not the anatomy, not the complicated things, but in very simple words, how we can do as a professionals and how we can help the patient to achieve optimal results uh, with safetyness.
Yes, definitely both. We privilege, we are the prevention is number one, education number two, and also the real expectation during the consultation. But the emotional part is also very important. That's the part that psychology today make a big role. And that's why I would love to hear a little bit more about your experience at Valley, because you are working with your mom. If there is a
Yeah.
specific protocol that we can, like it maybe can be personal, individual, or general protocol where we can add to our clinic or medical spa today for the injectable part.
Yes, of course. So when I'm working with my mom, sometimes I'm there in the office and I can help her with that. And the most important part is doing an assessment. So which kind of assessment we need to do? A cognitive assessment. Where is this patient standing in? Is this patient a person that is being influenced by other things? What does this patient want? um, what do they want to accomplish. They are doing this for somebody else, because I've seen with my mom and in our experience that they're doing this, for example, for their husband, or the husband is there and like he is trying to make her feel uncomfortable with herself, which makes her have a problem with her self-esteem. So I try to isolate the patient if they're coming with somebody else, and like talk to her, assess her. Hey, like, what do you want to do? Why do you want to do it? What's happening? Are you sure that you want to do this? Because this is a change. Some of them are reversible, but they leave, a consequence after if you take it off, and things like that. So in my experience, if you don't have a psychologist there, try to speak with one or try to get one in your office so you can have that psychological part there, or try to educate yourself on how you can assess your patient before talking about the whole process, so you can make sure that this is what they really want and how you can help them achieve exactly what they want. But I've seen many, many cases of people that they really don't want to do it, or they don't know what's best for them. So it is important, like I said, working psychologist and aesthetic professional, so with their knowledge as well, they can tell the patient, hey, I think what will work for you is this. We can use threads instead of doing, fillers or things like that. We can do this, or we can do a combination so you can also be happy. Because the most important thing there is being safe with what we're doing to the patient, and also them being happy with the results. So, yeah, I think that is the best way. Assessment and asking the correct questions and educating ourselves.
Thank you, Valerie. And the last question for Amber. How do you use science and experience to keep treatment safe and natural?
Science and clinical experience. Yeah, I feel like, especially like the question was saying too, the rapid changing, evolution of the aesthetic industry. There's all kinds of new technology coming out. There's always kinds of new products hitting the market and everything. And I think the main thing I do first is kind of just try and always stay informed on, what's out there, what's going to be coming out, whether it's we have lasers at my practice as well. So whether it's lasers in skincare and or injectable side of things, and really just making sure I'm knowledgeable about what's hitting the market, what's going to be new, and kind of just like watching that, I would say more so would be the thing. I do try and go to a lot of like dinners and meetings and stuff like with reps and things. Again, just to be more knowledgeable, whether learning from another injector is always a good thing, no matter how long you've been injecting for, or just learning about new products and things and kind of what's out there on the market. You don't know if you're not staying informed. So I feel like that would be the main, start of it. I personally, at least when it comes to a new product, even new filler and things like that, I let it hit the market kind of first and let it see how it does. I'm not necessarily one personally, at least to kind of jump on a brand new filler or whatever it may be. I do tend to like watch it, keep an eye on it, let it hit the market, kind of see how it does, give it some time with feedback and through, patient feedback and stuff to kind of see where it's truly at as far as in the aesthetic field, as well as, again, I own my own practice, but I tend to, again, have good relationships with the reps. So I usually, before I bring on, for example, like new filler or a neurotoxin to my practice, I'm always trying that out myself, injecting on models, to really get the feel for it as well. So I feel like those two things are important, just being knowledgeable, but then having some hands-on experience with new technology, new product that's hitting the market, before necessarily, jumping the gun and bringing it onto the practice. And then kind of just, yeah, using my experience and knowledge to kind of figure out, what's needed, what's not, and what's gonna give my patients the best, like, optimum outcome, along with for financial reasons too, and price ranges and stuff like that into the practice. So, but I definitely think just being informed and constantly just kind of staying up to date on everything and what's coming out is definitely half the battle. But again, if you're a new practice owner or a new injector or anything like that, not necessarily jumping the gun on, you don't need, 7 different filler lines into your practice, right? Like start with 1 or 2 that, are tried and true and kind of go from there, I think is important. Sometimes if you're a new injector, a new business owner, I've, medical directed for some that they're excited and they want to bring on all these things, but it's better to kind of start small and like build from there. I feel like is important as far as a practice perspective.
Thank you, Amber. And last question for Valerie. It is about the social media and trending when they come
Yes.
into the practitioner. So they come in with a picture in the hand. I want a face like Kim Kardashian. I want this. What do you recommend the patient when they come in with the trending treatment or TikTok or social media, Instagram in general?
Okay, when they come with that. So, in my opinion, from a psychological perspective, and also shaped by my experience with social media, it has significantly distorted the patient's expectations when seeking injectable treatments, right? And many patients engage in constant social comparison by watching other stories, posts, and everything. And all of them lead to frustration that often measure themselves against highly curated filter or surgically enhanced images that are not only unrealistic, but also they are unattainable, right, for the natural facial structure. This can also lead to patients to request specific features that do not only harmonize with their own anatomy, but also suggest exaggerated lip volume or overly contoured facial proportions. And in many cases, they are not seeking enhancement, but rather transformation into an idealized version of somebody else, right? And this reflects underlying cognitive and perceptual biases where individuals lose sight of their own baseline appearance. So when they come to your practice with a picture in hand, we need to see, okay, what do you like about this picture? Do you like how, I don't know, like her facial structure is like this, or you like her nose, or what do you like about this picture? After they tell you, no, I want to look like that. What exactly like that? And then we can take a picture of the person, assess them, like I said, and then seeing in which ways we can enhance your own facial structure. And because of this, it becomes essential for beauty professionals to engage in an open and honest communication with their patients and create a consultation that is balanced. So we can make that person get what they want from the picture that also works for themselves and their own facial structure. So, like we said before, it's basically educating the patient so we can achieve what they want, keeping them happy so they don't become a problematic patient, which was what I was talking about in the comments, because we don't want them to go and them being unhappy and but when they come with that picture in hand, ask them first, what do you like about that picture? Second, what do you want to accomplish? What will make you happy? Three, is this what you really want? Why do you want it? Oh, it's because I want to look like her or something like that. We already see that there's a dysmorphia or there's low self-esteem that you're comparing with somebody else. So we can address the person in a more different way and then getting them to be happy with not only with themselves, but with the procedure that we are completing on the person as well.
Thank you, Vale. Excellent, excellent comment. Very important for us because every single day we are just receiving patients with this problem too. Sarah, last question for you. It is about the difference of all the botulinum toxins. There is different branch. What is the difference of them, or what is your experience with getting better result from them?
I think about toxin. There is a different brands, and all of them um, are made in different platforms, and it depends of the patient, the skin, the metabolism, also the technique, the strength of the muscles of the patient. So everything that I mentioned, you have to have in mind and also explain that to the patient. It's not the same men and women. It's not the same thick skin and very thin. So many factors that can affect the lasting results and also like the patient metabolism, the toxin. So another factor that affects is what kind the toxin have you used it in the past, And if you want to change it, how long, yes, how long it lasts in your body. Everything you have to ask the patient before. As Valerie mentioned, the assessment is something so important to address patient requests.
Thank you, Sarah. Yes, this question is very common because they don't know. The patient said that they have a good practitioner who can explain to them, but usually they can, I want bottles, I want this, but I want, but they don't know exactly what they want. They don't know what they have before also. So that's why it's really good comment that you say that everything is important and we need to get our, the medical history just to know what we can do and explain to them what is the difference between the branch, because marketing is very important, but at the end of the day, we work with science. So that's our part that we have to explain to them. Amber, last question for you. What is the recommendation that you give them for maintenance? How many months, or is depend also the metabolism of the patient? What is your protocol in this case that you give?
Yeah, for neuromodulators you're talking?
Hmm?
Yeah, I definitely do again a consultation, especially if they're new to neurotoxins and things like that. But definitely up to a 2 week onset, so I make that very clear. I kind of also explain like about the week mark from today, it might be kind of half kicked in. So again, just kind of setting those expectations for them to be patient for the 2 weeks. I really try to in my practice, especially if it's the first time, even if they've gotten neurotoxins elsewhere, if it's the first time I'm ever touching their face and treating them, or if they're just new to the product in general, I like to always do a 2 week follow-up. And again, just kind of explain that initially that, I can look at it, make sure we don't need a little 1 or 2 unit touch up. Typically the forehead is more the troublesome area out of the three main ones. And again, just kind of explain that process to them. So that way, at the 2 week mark, say they might need a 1 or 2 unit touch up, they know that that's expected and might be needed, and not, say if they didn't know that, that's when they're like, oh, I don't think this worked or this didn't work well or whatever. So kind of just setting those expectations with the follow-up originally to get them on a good plan of care. That way, when I see them in like 3 or 4 months, we kind of have a good plan in place to go from. And then, yeah, just going over kind of what, Sarah was saying was just, if you're doing a lot of cardio, if they're a marathon runner, if they're doing saunas, hot yoga all the time, that could possibly metabolize the product a little bit more. So just kind of, yeah, reviewing that with them. And then also I literally at this point explain the nature of the neurotoxin. So it looks its best about 2 to 6 weeks in. And then about 8 weeks, I expect them to have at least partial movement. And then, about the 12 to, 3 to 4 month mark, they're going to have full movement again. And that's kind of when they can come back in to get retreated. So just really explain that process too. Some people in their mind, they think it's like, frozen for lack of better words, like at the 2 week mark all the way to 3 or 4 months. And that's just not how the product works, right? It just slowly metabolizes out of the muscle. So kind of just explaining that to them too, and it makes them really be more aware of like what the treatment can and can't do for them.
Thank you, Amber. Thank you, Sarah and Valerie, for your time and your information too. Today, we saw that all the injectable practitioners are not just about beauty, it's about science, safety, and also responsibility. That's why we are here every single day to connecting with all the professionals and listen and learn from all each other. Either we are doing the same, but we are learning. Always, always. We every single day we learn from all professionals. So that's the idea. Also, the real question is, are we are changing face or we guide them to get confidence, to get in the right way? That's the idea today. It's not only beauty. We are discussing beauty because that's the industry, but it's not only beauty. Remember, we have to focus in integral beauty, in and out. That's our purpose. That's why before to go for beauty, we have to learn by science because we are working with human, and that's the most important. Thank you to all the professional today in this panel. It was amazing, and I really enjoy and I learned from yourself. Thank you very much.
Thank you for the opportunity.
You as well, yeah.
Thank you. And remember, everyone who are connecting here, could you please follow Sarah, follow Amber, and also Valerie? You can just say like a little messenger for their social media, and also they going to answer you, and we can write a testimonial for them and they going to answer for us. This is all that algorithm is working today. We have to work together, we have to help each other. This coming and now new professional doing events, and we can support each other. Remember, there is an event that is going to be on July 11 and 12 here in New York. Is K Beauty, is focused in beauty regeneration, is from Dr. Lana, is going to be Judson Stella, who was in the morning as a speaker. Just go to learning from them too and do more connection. That's the purpose of Global Integral Beauty. We are here to be all together. If you need some support, we are here. This is the unique platform where we can connect multidisciplinary with all the professional in health, wellness, and aesthetics. Professional who are starting, professional who are in the middle of the career, but also an expert. So years ago, the only way to connecting with the expert is when you go into Congress and just only to see them far away. Now, we all the technology and also the opportunity to be connecting with them, that's number one here in Global Integral Beauty. Thank you very much, and we're going to continue with the next presentation. We are invited for the next speaker. First, we're going to see the video and also one promotion that we're going to give away now. So every people was registered. Oh, Dr. Lana is here. Dr. Lana, do you want to invite everyone for your conference? If you are here, you can connecting and you can invite everyone for your conference, doctor. Could you share the perfect?
Hi
So
guys, thank you. Hi Dallas. Hi
hi,
everyone. Hi
hi,
Kat. Oh my
hi,
God.
Dr. Lana. I just was talking about you for your name. I'm so excited. I was talking like the only way to work together to continue growing is work together. And
Absolutely.
I would
Yeah,
like to invite everyone to talking a little bit more about your conference, doctor.
yeah, first of all, Dallas, thank you so much for putting everything together. You're such a community builder, you're a super connector, and you really care. And so that's why I've been with you for so long, just because you're such, you're so great. And everybody in your community is always very uplifting and helpful and elevating. And that's what we want to do. We are hosting our very first K Beauty Regenerative Congress in Manhattan, in New York City. It's going to be July 11th and 12th. It's 2 days. And we're going to go over all the amazing philosophies that you're getting out of the US. So, all the amazing philosophies from Korea specifically, and really understanding how to make a holistic approach in your consultation and the art of consultation to your patients to build a program where patients are not coming in for monotherapy alone. We understand that nowadays everyone is coming in for full facial assessment. We're giving them the 360-degree blueprint so that they stay with us for longevity, right? We're not talking about just skin quality or skin span. We're talking about the whole holistic approach. And one of the things for the K Beauty Conference, as Idalis was talking about, is that we're really going to really kind of melt together all the things that we do for face in the form of lasers, energy-based devices with RF. We also have amazing regenerative procedures that we do. We're going to have sculpture, hybridilute radius. There's also some nuances that are done outside of the states that are legal. For instance, really combining HA with KAHA, right? And really understanding how that works, combining PRP with sculpture. And some of the different blends to kind of opens up our eyes to the things that we can do. We're talking a little bit about skincare and all the K Beauty skincare that's coming. But overall, this is a conference for us to be together, to really elevate, to kind of bring in different ideas to help elevate you and your practice. And we're going to have a gala as well. I was inspired by you, Dallas. The gala, we all love to party, we all love to dance, we all like to have fun, right? And so imagine rooftop Saturday night at the top of the loft space at the Virgin Hotel. It's gonna be really fun, and our goal is to build community, get everybody excited for all the innovations, all the technology, all the different philosophies, so that you can bring it back to your practice and you can understand how to motivate to the next level and motivate your whole practice. We're gonna have business training as well. Those of us who've scaled to 10 plus locations, really understanding the startup to the scaling with the operations in place and then to the exit. So there's really a lot for everybody there. So I'm really excited, and thank you for allowing me to jump onto your beautiful platform. I want to hear what everyone else has to say.
It is a really pleasure, Dr. Lana. Remember that we have to be united. We have to work together. So this is your time. I'm inviting everyone. I went to your office. I tried the new treatment, and I show everyone because that's the reality. The only way you can be the best, you can be the most intelligent woman, but if nobody know you, nobody's going to find you, and that's the purpose of Global Integral Beauty. We only work in position yourself. You want to be one of the top, as the Dr. Lana. Everyone are invited for this conference, Dr. Lana, and then after Dr. Lana, everyone is coming for Global Integral Beauty. October 17 is at the end of the year, where everyone is celebrating as like the number one aesthetics in the worldwide. So that's the idea. This is the time for Dr. Lana. We're going to her, and then we're going back, everyone, for Global Integral Beauty. Thank you, Dr. Lana.
Thank you, mi amor. Gracias.
If you have any coupon, something, we're going to do a raffle in a few now. So we're going to give away one standard ticket for Global Integral Beauty. So let me know you want to do something here, and we're going to do it. Let's go, Luis, the roulette. Okay, let's go to the sorteo. Let's go. The raffle. Okay, let's go. Okay, the winner, Adeli Neulin, is here. Adeli, I saw her a few minutes ago. I don't know if still are here. Adeli is here. Okay, it's not here. The next one.
Oh, she just responded. She's in the chat.
Okay, perfect. It's okay. Okay, and Carmen Morales. Okay, we're going to continue with the presentation with Brooke. Dr. Lana, if you have some giveaway, give me, and later at the end of the presentation, I'm going to just, if you have any special discount, anything that you want to offer us, let me know in the chat, and I'm going to offer them at the end of the conference, okay? Thank you, Luis. Let's go for the video, please. Bru, are you ready?
What if the next level of your career wasn't found in another course, but in the room where global leaders gather? For years, I've built an international platform dedicated to elevating professionals in health, wellness, and aesthetics, not just through education, but through visibility, collaboration, and global positioning. Many talented professionals remain unseen. They invest in their craft, refine their skills, yet struggle to access the level of exposure, connections, and recognition required to truly expand. Because success today is not only about what you know, it's about where you are positioned and who you are connected to. The annual Global Integral Beauty Conference is not just an event, it is a global ecosystem designed to accelerate your growth, your brand, and your influence. A curated high-level experience where education, networking, recognition, and visibility converge in one place. Here, you gain direct access to international speakers, industry leaders, and innovators shaping the future of aesthetics and wellness. You step into powerful networking environments designed to foster real collaborations and business opportunities. You position your brand in front of a global audience, opening doors to expansion beyond borders. And for those ready to elevate even further, this is where recognition happens, where your work, your story, and your impact can be acknowledged on an international stage. This is not attendance, this is alignment with a global standard of excellence. If you are ready to elevate your brand, expand your network, and position yourself on a global stage, join us at the annual Global Integral Beauty Conference. Sign up now and step into the room where your next level is waiting.
Thank you, everyone. Again, welcome to Brooke Kennedy. Brooke is a master esthetician and she is one of our global integral beauty leader. She's also one of our co-author and ambassador of Global Integral Beauty. And also she is part of the advisor board too. So we are so happy to introduce Brooke today and also continue working with her. She's growing an amazing platform. She's growing. I saw her in a couple months, 1 month ago in Dallas. She was a winner. She get the awards in skin game too. So welcome, Brooke. Could you introduce again yourself? Talk a little bit about you before to start your presentation, please.
Yes, thank you for the lovely introduction. Yes, my name is Brooke Kennedy. I'm a master esthetician and I own a salon and spa called Sweet Bee Hair and Skin Lounge. It's located in Issaquah, Washington. And what my focus is on medically compromised skin and specifically working with oncology patients. I am oncology trained as well as an advanced trainer for oncology spa solutions. And I wanted to share with you all today my favorite find of 2025 and being introduced to a fabulous hypochlorous acid formulation. So I wanted to share today the power of hypochlorous acid in modern aesthetics. I know it's trending, there's a lot of formulations out there, and many people have questions about it and what is it exactly. So I figured we would get into the science of it. So you can see from this lovely little slide here that hypochlorous acid, so it's actually produced by our white blood cells. Our neutrophils produce it. So I love this little diagram because you can see if there's a wound site or an invading pathogen, then neutrophils are going to migrate to that infection site. They are going to engulf that pathogen, destroy it with hypochlorous acid, which then promotes healing. So it is our body's first defense against pathogens and injury. And the beautiful thing is it's non-toxic, biomimetic, and safe for all skin conditions when in its pure form. And that's what we're going to get into. Hypochlorous acid attacks that we'd already talked about by invading the pathogens, by breaking down the cell walls before destroying the unhealthy invaders. So in its pure is 2 ingredients. So you take NaCl, which is going to be your salt, plus your water, which is your H2O. Then they electrolyze it. And Hypo 21, the brand that I love, actually has a proprietary filtration system. So with their packaging as well as that filtration, they are able to achieve a correct pure balance. And then the scientific foundations of hypochlorous acid is the antimicrobial power. So it kills up to 99.9% of bacteria, viruses, spores, and fungi within seconds by disrupting their cell membranes. It's anti-inflammatory, so it reduces redness, irritation, and flare-ups. I specifically list the acne, rosacea, eczema, and psoriasis here because Hypo 21 actually did a clinical trial for those 4 different skin conditions that will pull up the clinical trial results here soon. And the healing, so it accelerates skin repair and collagen activity, and then it's barrier safe. Since our bodies produce hypochlorous acid, it's gentle, biomimetic, and non-sensitizing, again, when it's in its pure form. And then the key benefits in skincare, which we all love, is the acne management. Since it is antimicrobial, it controls the acne-causing bacteria, the C. acnes, without drying or irritating skin like benzoyl peroxide sometimes can, as well as other ingredients. And then post-procedure care. So it reduces the infection risk and inflammation after microneedling, peels, laser, waxing, sugaring hair removal, extractions, injectables. Tattoo artists, permanent makeup artists use it for that post-procedure care as well. And then for eczema and psoriasis, it calms the itch, reduces the redness, and promotes healing. When I had brought it into my practice, my husband was the case study for me, and it helped clear his eczema within 2 weeks at using it twice a day. And then the age management support by lowering the chronic inflammation. It reduces oxidative stress that accelerates aging. And daily care. With the Hypo 21 being in its pure form, you can use it in daily care. A lot of dermatologists will ask me if it's possible to overuse it, but when in pure form, it's not. So daily care, yes, it can be safe for all skin types, including infants. So it's great for diaper rash, cradle cap, baby eczema, oncology patients. I have used it successfully for radiation dermatitis paired with red LED light, and for highly reactive individuals. And then the multi-use versatility, you can use it as a face mist, post-gym workout, wound cleansing, hand sanitizer alternative, oral care, baby care. I've actually used it on my dogs. He has severe allergies, so it really helps him. And then eye care when it's actually properly formulated. Hypo 21 I have used to treat styes in my own eye, and due to the pH, it does not affect when putting it in the eye or on open wounds. And one of the historical facts, which is kind of fun, is that Army medics in World War I and World War II used hypochlorous acid for wound cleaning and to neutralize chemical burns. So hypochlorous acid was first used in the First World War back in 1914, and it took a practical turn to help medics treating field wounds. It was used to irrigate the wounds where it was noted that soldiers healed in half the time as those who didn't have that same opportunity. And then professional applications, and that's why we're all here, right? Is to learn new things. So post-procedure recovery. So we talked about channeling, microneedling, peels, laser, surgery. My father-in-law had basal cell carcinoma. So he had it on his nose. He had a Mohs surgery. And then he had to go in for reconstructive surgery because they took a piece of flap from his forehead to reconstruct that area. When the stitches came off, and that's not one of the slides I have to show before and after. I wish I did, but I don't have it on this presentation. My apologies. But when he took the bandages off, he used it twice a day for 8 days, and the healing was incredible. So if anyone is interested, I'm more than happy to show you that photo if you'd like to reach out to me. And then acne care, we talked about how it kills the acne-causing bacteria by helping to reduce the bacteria as well as calm inflammation. And then we talked about compromised skin, barrier repair facials, and we talked about how it's great for oncology safe treatments, plus waxing and ingrown prevention. I use it pre and post sugar and hair removal. It's been very successful. We have some good accounts that have used it for helping to treat HS, which is your hidradenitis suppurativa. And then a pre-treatment skin prep because it's going to reduce that infection risk and calm the skin. An example would be to use it before injectables. And then I just wanted to kind of touch on how not all hypochlorous acid is created equal. So poorly formulated hypochlorous acid products are chemically unstable, which means they may degrade quickly, becoming ineffective, or worse, contain residual sodium hypochlorite, which is your bleach, or imbalanced pH levels that irritate the skin. And due to hypochlorous acid being fragile and unstable, that's why there are many formulations that have had to use additives to help stabilize it because hypochlorous acid is very sensitive to light as well as heat and how the pH levels can shift. But when you're doing the additives, it may no longer be biomimetic. So that bioavailable where your body can recognize and use it. And when the pH is not skin friendly, then it may irritate the skin. So here are the clinical trial highlights that Hypo 21 had conducted. It's actually a product that's manufactured, including the packaging in the UK. They did a 12-week clinical investigation on 100 participants, 25 each, with acne, eczema, psoriasis, and rosacea. They used it twice daily of that Hypo 21 purifying skin spray. So it was conducted in a multi-center open label prospective study. And the key findings, this is what's fantastic. So for acne, 85% improvement, With eczema, the 81% improvement, psoriasis, 78% improvement, and rosacea was 84% improvement. Those pictures there, I'm sorry, because we were just limited on slides due to the time. So that's just my leg. So I get a mosquito bite. This has nothing to do with the clinical trial, but you can see on the left-hand side, I react horribly. It itches and swells. So I love to timestamp. So you can see that 24 hours later, it was nearly gone.
That's good.
So what sets Hypo 21 apart? They have done the nearly impossible in my search of what I wanted to bring into my practice, especially when treating medically compromised skin. And that nearly impossible was creating a pure formulation. In addition to, they were able to obtain FDA and MHRA registration. It's CE and UKCA marked. It's actually registered as a medical device by the MHRA. It's bioavailable, biocompatible, no toxic stabilizers or additives, a skin-friendly pH at 6.5 to 7. So that's why we're able to spray it directly on open wounds without it burning. Children love it. One of my best friends has a 3-year-old. He goes and runs and grabs the bottle anytime he gets any cut, bite, or scrape because it doesn't burn, and he loves it. It's as gentle as water. So Hypo 21 is pure, vegan, stable, efficacious, and sustainable. So due to their special packaging, that proprietary filtration system, they're able to keep it pure, efficacious, and stable for 1 year. And as dermatologists have asked, is it possible to overuse it? And the answer is no, not with Hypo 21. Since it's a pure formulation and your body recognizing it and only containing the 2 simple ingredients, however, a very complex formulation, you may apply as often as needed. And it's safe to spray on all skin types and all body parts. People have used it for hemorrhoids, fissures, mucous membranes. They'll spray it for a sore throat. They will spray it if they have a canker sore in their mouth. Like literally, you can use it on everyone and everywhere. People ask, are there incompatibilities with it? And no, if you do clean, dry skin, spray it, let it completely, fully penetrate and absorb, your body will then use it and you can carry on to next skincare steps. So literally, we may be incorporated into any treatments as well as any skincare programs. Oh, and then the picture, sorry, I didn't talk about that, but that is my friend Kelly. And if you're unable to see the date, she cut herself in the kitchen with a knife and had to get 6 stitches, and that was on May 17th. She sent me progress photos, and then you can see on the lower right-hand photo, that was May 31st. So it's been absolutely incredible. So I just wanted to share my favorite find of 2025, how it's changed my practice, how I may use it for everyone, and how it's truly changed my patients' and clients' lives. Ta-da!
Wow, you did so fast. It was good. Thank you, Brooke. Thank you for the presentation. Wow, that's amazing. I really that information is so important today. As we talk, I remember the first presentation. We was talking about the oncology, the aesthetic oncology, and usually when we talk, we mention about that years ago. Today, no anymore. Like oncology, it was like everyone was so scary. So what happening? I don't want to have that. Or they was the word case, they was thinking like symbol that. So today is totally different, especially in aesthetics. So in and it was 2 years ago, I believe, no, year and a half, 2 years ago when we started with your training and you was starting recently with training. And now look at all that you are doing, how you grow today and how important is to educate this aesthetic industry, not only to do the treatment, but also to get the information and just referring for practitioners who are working in this industry too. So let's see if we have any question about.
And a lot of people do ask me where I've received my oncology aesthetic training because it is great for nurses, doctors, anyone. So Oncology Spa Solutions is one. And oncology, and that's Becky Keene's program. She's actually been on iDalas's networking and various, she may have been on a seminar in the past. And then you have Morag Curran. She has Oncology Training International. So that's a great training as well. And then Holly Brown has evolved to now I believe it's a 2-day, and she focuses more on case studies, and that's with Look Good, Feel Fab. So those are just some recommendations for any of those of you that want to become oncology trained as well.
How long is going to be the training?
The Becky Keene's is 2 days. Nichelle's coming on. I was gonna say, Nichelle, do you remember how long Oncology Training International is? Because I did it online. Is it still 1 day, kind of 8 hours?
I believe it's a 1-day course.
Yes. And then
Yeah.
Becky's is now online, but it used to be a 3-day. So it was 2 days of theory, kind of going more into the medications, and then doing a hands-on for the third. So that's what I love, is that they're all different. That's why I took each of them, just because they all have something to offer. And then how I mentioned Holly's is going to be more about case studies and things that she's like great befores and afters, and how to treat certain types of people undergoing different cancer journeys.
Okay, so there is any in different grade or just only one class, one master class, or you are doing in modulo or different advanced, basic, or it's just only one?
So all online as an option, except for Holly's is now 2 days. So 3 different programs, but you can do online. So Holly would give you the in-person. Becky's third day is in person, where you're actually working with people, cancer survivors, or those still currently in treatment. And then Morag's is online.
Okay, that's perfect. So could you send me the information, please?
Absolutely.
All the details about the information we can share with everyone through email blast and also in the stories. And because a lot of people wants to learn, but they don't know where to go. So again, that's the best platform where we can connect, but also we can share all our information to give the opportunity everyone who are in the community or outside the community just to introduce yourself, because now we know that you are one of the experts in this industry. Okay.
Yes, perfect. Thank you so much.
Thank you, Brooke. And now you cannot go away because we have you again for the moderator for the next panel. But before to start the next panel, that is going to be mental health and aesthetics, I would love to share another video too, and then we can waiting for the panelists to be here in the screen.
Attention global integral beauty community. Nominations for the 2026 Awards Gala are now open. And this is not just another gala, it's your night of recognition, your moment to shine, your legacy on stage. A night to celebrate the hard work, passion, ethics, and professionalism that have brought you here. Are you a legend who has left a lasting mark, an epic leader creating global impact, or a revelation breaking boundaries with innovation and power? This is your opportunity to be nominated. Don't wait any longer. Visit the site, nominate yourself, and become part of an evening that will transform your profession forever. Because we all deserve to be recognized for what we love to do, right? Your story deserves to be celebrated. Comment award and we will send you the 2026 nomination link.
Everyone who are here are ready for October 17th? Raise your hands. Tell me who is coming for October 17th. We are everyone ready for this to enjoy this amazing day. So I wait for you, everyone. So right now we are waiting for one speaker. Is Brenda. It's Brenda, no? Let me
Yes.
check. Yes, let me see. Yes.
I'm excited to meet Lisa because I have the pleasure of knowing Nichelle, Elizabeth, and Brenda. So Lisa, so nice to meet you.
Hello, nice to meet you as well.
So we can start to introduce everyone themselves until Brenda comes, so we can give her a little time. So this panel is going to be mental health and aesthetics. Brooke Kennedy is going to be the moderator. She's again one of our leader of Global Interior Beauty. She is a co-author of Global Interior Beauty bestseller book. And also she's an ambassador too. And also, oh my God, too much position. And also she is an advisor. She is one of the advisor board of Global Interior Beauty. She's doing really good job, and I'm so happy for you, Brooke. You're growing a lot, and we are here to continue working with you. That's our idea. Thank you, and I love that you share your experience during this 2 year with Global Interior Beauty.
Just the support. I just love the community. When I was at the conference last year, it was incredible. Michelle was there. She got to see it. It was just so much fun, just from all the speakers. And I just love how you're combining people from all over the world. And then you have your medical professionals, you have us estheticians, psychologists, nurses, like you're just bringing everyone together and constantly providing the networking as well as the opportunities. I was part of the seminar last year and absolutely loved it. So you're doing incredible things at Allison have with your team, of course, and just have created truly something beautiful. So thank you for all that you have done for all of us.
Thank you. Thank you. Remember, that's not for me, it's for all of you. And that's why I always say take advantage of this opportunity because it's the unique platform who are combined all the professional in the health, wellness, and aesthetics worldwide. That's the only way to continue growing is for you because you took little bit time from yourself to dedicate for global integral beauty, but not for me, for everyone. Look at today, it's amazing day from 9 o'clock in the morning. We have a lot of good speaker, doctor, plastic surgery, nurse practitioner, psychology, the esthetician, all combination today. And that's the idea. That's the idea. We can stop 6 years consecutive without stop. Every single month we continue doing the networking, one in English and one in Spanish, and two seminary, virtual seminary in Spanish and two in English. And also the conference. But the conference is the number one because that one is where we celebrate all together. That day we have each other introduce ourselves. It's a beautiful energy. At the end of the year, it's the best moment. You know, everyone is tired because we are working a lot during the year, and we're going to celebrate that day. So let's go to start because it's 12:13. So we have a little bit time, I believe, no?
Yeah, I think that she's probably not aware because we're ahead of schedule. You and your team reached out to us, which is fabulous, but she may not have received the messages yet.
Let me see. Yes, we have how long? Like 10 minutes before, no? Okay. So in this moment, I would like to know if you have any additional question before to start with Brenda. We can wait for Brenda. If you have any additional question, everyone who are connecting here, remember everything is recording, and then we are doing little story for each one, and then all the presentation also is going to be we're going to edit the presentation and then we share for everyone. That's why I always told you, don't focus in audience, focus in yourself, focus in your experience today, and just connecting with everyone today. So let's go to start with Lisa. I would like to hear about Lisa. Tell your introduction, a little bit about yourself before to wait for Brenda. Lisa.
Yeah, sure. Thank you so much for having me today. So, good morning, everybody. My name is Lisa Wetron. I'm a registered dental hygienist with a background spanning over 2 decades in dentistry. My work is rooted in prevention, patient education, and advocacy, and really centered around connecting between the connection between oral health and overall health and how people really see and feel about themselves. When we talk about global integral beauty, we're not just talking about aesthetics. Obviously, we're talking about our identity, confidence that we have, whole person wellness. So as a dental professional, we have a unique opportunity to influence not just smiles, but lives. And so today I'm really excited to play a great and powerful role in shaping self-esteem, mental well-being, and how to show up more intentionally for our patients in that space.
Thank you, Lisa. Thank you. That we was talking from the beginning. That's the idea. We have a mix of the professional, but also we visualize how important is each one for our practice. Because at the end of the day, we don't have competition. We don't have a competition. There is so many estheticians, there is so many doctors, there is so many nurse, but each one are focused in one area, expertise in the technique, in my protocol, my method, or my everyone have something different. But everyone is focused in the same industry and focused in the patient. And the patient is integral beauty, in and out. So that's why we are here. Elizabeth, could you please introduce yourself, talk a little bit more about yourselves to know about you until Brenda is coming?
Yes, absolutely. Hi, everyone. Elizabeth McKenzie. I am coming up on 16 years of being a licensed esthetician. I'm also a Reiki master, a sound practitioner. I have an online academy called High Vibe Skin Academy, where I really focus on holistic advanced treatments for estheticians. It's all rooted in really the connection between our emotions and the skin. That's how I also practice in my private practice. I had severe cystic acne and didn't know it at the time, but with all the research I've done, what I know about it now is a lot of it was just suppressed emotions that were manifesting on my skin. And then, also it can go the other way if we're not, regulated in our body, then we might not respond to treatment. So that's my whole philosophy.
Thank you, Elizabeth. Thank you. And you are welcome
Happy
to
to be here.
Global Integral Beauty. Oh, we have Brenda here. Hi, Brenda. How are you?
Hi,
Yes,
good ladies. How are we doing today?
I'm fine. We was waiting for you. Michelle, I would like to hear again from you. Michelle have amazing experience we have too. She also helped us to connect with a lot of professionals. She have a very, very good experience. She's a really good connector too. And I appreciate everything that you are doing for Global too. You are welcome. As always, my doors are open for you, Michelle. Could you introduce yourself again?
Thank you. Thank you so much, Idalis. It's such a pleasure to be here. Thank you so much for this platform. My name is Nichelle Foster Mosley, and I'm widely known as the Barrier Queen in my area. I've been working now for 2 decades educating, and my work is centered around the intersection of barrier science, somatic wellness, and clinical aesthetics. And I mostly serve global majority skin. So I speak to, melanin-rich skin and how to treat that specific population. I am an award-winning licensed esthetician and a Cedesco certified educator. Like I mentioned before, I specialize in corneotherapy. So that's one of my specialties and one of the things that I love to educate people on. I do have a nonprofit, the Whole Beauty Impact, which is meant to help with helping you to bridge the gap between understanding, how to incorporate some of the things that Elizabeth was just talking about, just some of the somatic experiences and things that we need to incorporate for the whole ecosystem that is our body, right? So I really love doing that work and I'm so happy to be here. Thank you so much for having me.
Thank you, Michelle. And Brenda, how are you, Brenda?
I'm good. How are you, Idalis?
Good, good. Thank you to
Good.
part of this seminary. I would love that you introduce yourself before Brooke started to work with this panel.
Awesome. Hello, everyone. Just want to say thank you for having me here today. I'm Brenda Hogsett. I'm a 14-time international award-winning master esthetician. I'm an educator. Um, I am a educator and rep for multiple skincare companies, also waxing companies. The list goes on. I've won many awards in other avenues, from the Skin Games to Global Integral Beauty, as well as Modern Salon Top 100 Beauty Professional 2025. So I have a lot of accolades, and I love also mental health in the beauty industry, just because I do have bipolar and PTSD and a whole bunch of stuff. I tell people on paper, I look like a hot mess. If you were to read all my stuff, but I tell everybody I'm medicated, and that's the most beautiful part of it. And I'm also with therapy and all that. I like to shed light on that in the industry because there's no shame in it. There's no shame in needing to have therapy and getting help. We need to live of mental health beings. We need to work with it.
Thank you very much. I appreciate that you share this experience because there is so many people who are here without diagnostic, without medication. And they also didn't
Mhm.
know. They also didn't know either. So how they can help each other or how we can help them if they don't have either some of them have a diagnostic and they don't want to
No.
take medication. And they thinking when they have the diagnostic, they thinking that is there is no life for them. And that's not true.
Oh, they think so. So here's the thing. They don't get help. They don't get help. They suffer alone. They feel like they're the only ones that have something, whether it be depression or postpartum. Postpartum happens all the time when you have babies. So everything, like we suffer in silence, but I like to shed the light to let people know you're not alone and that it's okay to come together to bring this community together as women, as professionals, and that we're here to just be a pillar for each other to lean on.
Thank you very much. Thank you, because that's the best way how we can educate our community. We are not perfect. We are professional, but we are human. We have disease, we are fat, we have wrinkle, we have curly hair, we have everything. Because they look at us like we are like the best. Why want her? Because she's the best. Yeah, I'm the best, but I'm human too. And
Exactly.
I love that information from Brenda. I have awards. I'm doing everything, but also I have this.
Mm-hmm.
It,
And
this is not, we
no,
don't need to penalize her or don't
nope.
go to her because she have this. No, it's the opposite. I
Hmm.
have this, I take care of myself, and I have this diagnostic, but
Yes.
you have it, you can do the same or better than me. That's perfect, Brenda.
100% is that you could still be successful and still have mental health issues, and that's okay. That doesn't make you disposable. That doesn't make you thrown out into yesterday's trash. That makes you human, and that we all need help, and that's okay.
Excellent, excellent. And that's the topic of this panel. That's the topic. So, welcome, Brooke. This is your time.
Thank you. Again, I'm so excited to be with this lovely panel. I'm excited to get to know Lisa and start following you because, like I mentioned, I have the pleasure of knowing Nichelle, Elizabeth, and Brenda. Nichelle, I have taken classes from, and you're on the board for corneotherapy, for International Applied Corneotherapy as well, correct?
Yes.
Yes. But we get to start with Brenda. So
I,
the last introduction, and we're going to do the first round of questions, starting with Brenda. So, from your clinical experience, Brenda, how do you identify when a patient's aesthetic concern may be rooted more in emotional or psychological factors rather than purely skin-related conditions?
Here we go. Okay, so from my clinical experience, one of the biggest indicators is when the level of distress doesn't match the severity of the skin concern. For example, if a client may have very mild acne, minimal pigmentation, I cannot say my words today, or normal signs of aging, yet they speak about themselves with intense shame, or self-anxiety, self-criticism, often tells me the issue is much deeper than the skin itself. So um, what they see and what they tell me are two different things. And so I like to listen to what they say and how they talk about themselves. I also may pay attention to patterns such as constantly changing goals, unrealistic expectations, obsessing over minor imperfections, excessive mirror checking, clients always checking the mirror, or believing one treatment will completely change their life or their happiness. So that's not a realistic expectation. Sometimes clients often they don't truly seek better skin. They're seeking confidence, validation, healing, or relief from emotional pain. Confidence in skin, but we are not mental health professionals. My job is to listen compassionately, educate honestly, set realistic expectations, necessary, gently encourage outside support if I feel emotional wellness may need attention beyond skincare.
Look at you. Well said.
Thanks. Thank you. Thank you.
Now we're going to head to Nichelle. So, Nichelle, how does cultural identity and representation in aesthetics impact the mental health and self-perception of patients, particularly within underserved or underrepresented communities?
So, what I can say about that as someone who is part of that particular community, visibility is something that really does shape your identity. And when that standard excludes you, that harm isn't really loud, but it is real, right? So, that's why this work matters. That's why what we do and how we speak about things and language matters. Because representation, it's something that if it's not seen in aesthetics, it can be a detrimental to someone's mental health. When people they don't see themselves reflected, when they're not in education, when they're not in imagery or outcomes. I think that they can sometimes internalize that. That's exactly what I did, and that internalized absence it can wreak havoc on, so many things, as to whether that person has the ability to treat you, or whether that person has, an understanding on how to, treat everyone. And if that's true, then they should, provide that representation, within their ability. And so I think that, when we have a specific standard and that standard excludes you, it does create those psychological, you know, that psychological feeling where you are not having that sense of belonging, and that can be very harmful. So I think when clients come to see us and they have questions about they're normal, and we can inadvertently speak to things that are specific to correction, and without context, that can be very pathologizing, right? So we have to be really mindful of the ways that we speak to our clients, really have an idea about what they're coming in to see you for, and if that has any sort of underlining sort of body dysmorphia, and if there is, additional support or additional resources that would be necessary. I think that that's something that we have to be open to, and, especially when it comes to clients who are underserved, right? Because those people are very vulnerable. They have trauma impact. And for that reason, I
Yeah.
feel like, we should be people who want to serve everyone that walks through our doors. And so having that information is something that we all should do. And I think it should be more standardized than it is, really. Yeah.
And that's exactly what you're trying to do. And so thank you for all of your work, everything that you've contributed. It's fabulous.
Thank you so much. And I'm sorry I didn't get to speak before, but yes, I am on the International Association of Applied Corneotherapy. So if you are wanting to hear more about corneotherapy or learn more about that, and just have a better understanding of what barrier science is, please, look into that particular association, because they're a nonprofit and you can learn information that isn't related to a brand, and that's really important for us as estheticians, as providers, so that we are empowered to just provide information to our clients that's unbiased. So thank you for asking about that.
Yeah, I was like, where is the conference this year? Is it Germany?
It's in London this year, so
London.
yes,
Yeah.
yes, so
I'm gonna make it
exciting.
there. One of these years.
No, let's go for London.
I don't feel to go to.
Yeah, I
Yes,
can
I
make
love that. The IAC is incredible. Okay, Lisa, now I have a question for you next. From your perspective in oral health and facial aesthetics, how do smile aesthetics influence a patient's self-esteem and overall mental health?
So one thing a lot of people don't think about in dentistry is how much anxiety people walk in with. And, everyone thinks that they're the only one. They're the only one who is nervous of the dentist. They don't like the dentist. And a huge part of our job is really making the patient comfortable and making you feel okay with being there and going through the process of everything. But I think with smile aesthetics, it can have a very real impact on self-esteem. Obviously, our smile is tied to everything that we do when we show up in the world. So being able to show our smile and properly, be able to communicate and laugh and speak confidently is such a huge thing. And being photographed, especially, if we don't like the way that we appear. So in clinical practice, I've seen patients that, cover their mouths when they laugh, avoid smiling in photos, talk about delaying job interviews and social events because they're missing teeth or their teeth are stained. They have periodontal issues, misalignment. And while other aesthetics can absolutely improve confidence in some patients, I think it's really important that we as providers recognize that cosmetic treatment alone doesn't heal the deeper emotional struggles. So if someone believes that changing their smile will completely solve an underlying self-worth issue, we really need to approach that carefully. And that's where ethical care really comes into play, because we should really be asking, are we helping someone feel more confident in a healthy way? Or are we reinforcing that unrealistic beauty expectation that there really is out there in the world? So the most rewarding outcome seems to happen when aesthetic dentistry is paired with the education, prevention, and realistic expectations. Sometimes confidence comes from veneers or whitening their teeth, but sometimes it comes from helping a patient eliminate pain and restore function, treat periodontal disease, or simply just feel seen and supported. So overall, a healthy smile can absolutely boost confidence, but true self-esteem has to be built deeper than just appearance alone.
Well said.
Mhm.
Yes. Mm-hmm.
Yeah. Yeah.
And
It's
Elizabeth.
definitely.
Oh, go ahead.
No. I was just going to say it's definitely, an interesting thing being in dental, because a lot of that is we don't think that patients have a lot of these fears or concerns that are connected to their specific, oral health and things like that. So, anyways,
No,
thank
very
you.
true. And that's why I love how you said just making a big part of your job is to make people feel comfortable because a lot of people do come in with that anxiety and just different methods and how you do that. Mhm. Okay, Elizabeth, I just had the pleasure of being at the Men's Aesthetics Conference and Associates, also known as Mecca in Arizona with Elizabeth this week. And Elizabeth, I love the frequency. You'll have to tell them what you just had developed because it's absolutely incredible. And the I'm empowered is my favorite. Also, I was talking to someone else and that was their favorite too. So before
Oh,
I ask
good.
you a question, tell them what I'm talking about.
Yeah, so I just recently launched some skincare products, and the whole philosophy behind them is, treating emotions and the skin, the whole inside out approach. And they're all frequency infused with different sound frequencies that are associated to different chakras, which are associated to different organs, different emotional ailments, different skin ailments. So they're all natural. Each one has an affirmation. You can choose one as a practitioner, intuitively based on what your client needs, what they're telling you, or you can let your client choose based on what scent they're attracted to.
Yeah, I love that. I just wanted to bring that up, especially because, yes, I absolutely love it. But since we're talking about mental health and aesthetics, I think it's amazing what you have created, like you said, based on chakras, based on how they're showing up, based on how we may assist them. So well done. Beautiful packaging and product. Everyone check it out.
Thank
But
you.
for your first round of questions, how do holistic practices such as Reiki and sound therapy complement aesthetic treatments and supporting a patient's emotional balance and mental well-being?
Yes, absolutely. So it's really getting a chance to treat the whole person and not just the skin. We still, it's coming around, but we're still seeing a lot of just treating the skin topically only. And they're more than that. Clients are carrying around tons of stress, emotions, they're dysregulated, and all of that is showing up on their skin. And so Reiki can help to support energetic flow and just kind of move the body out of that stressful state. And then I also love to use sound therapy. There's all kinds of different frequencies, and they can just help calm the nervous system, help shift our brain waves, and just bring that body back to that parasympathetic, rest and heal state. And then when our body is feeling safe, that means more healing and our skin outcomes can improve. And then that helps reduce like our inflammation, it can support our barrier, increase the response to the treatment. Yeah, it's just they're such beautiful complementary modalities to create a space for the client to release, to regulate, to kind of reconnect to themselves and create a whole mind body experience, not just giving them a facial, really.
Well said. I know a couple of my favorite tools to use. I love acutonics as well as sound bowls and facials. Ultimate relaxation, that sound vibrational healing.
I
Yeah.
always use like the analogy for sound healing of like, think of like a clogged pipe. And, we have stuck emotions in our body, and you need to like use the vibrations to rattle out, the stuck emotions and the stuck energy in the body. So, and unclog that pipe so that we can be in a flow state.
Yeah, that's a great analogy. Yeah, thank you.
Yeah.
Okay, Brenda, we're back to you because I see that you're muted. Hi. I'll make sure her connection. Can you hear me, Brenda? Yes. Can you hear me?
Yes, I can, Mike. Yes, I can. Can you hear me?
Yes. Okay, I just wanted to make sure before I asked you.
Okay, good. Okay.
Okay, so Brenda, how can estheticians create a treatment environment that not only improves skin health, but also supports the client's mental and emotional well-being?
Ooh, good one. Oh, hold on. Here we go. Where's it? Okay. All right. So, estheticians, us as estheticians, we definitely have a unique opportunity because the treatment room becomes more than just a place for services. You know, in our treatments and all the things that we do, it can become a space for restoration, safety, healing, and the confidence building. Many clients come to us, they carry stress, they carry burnout, grief, insecurity, or emotional fatigue. Um, Even if they never say it, okay, because I tend to, and I don't want to toot my horn, but I feel things. I'm an empath, but I can feel people's energy before they even walk into my space. I can be in the building and I feel an energy and I feel something off. It's a God-given gift. I will tell you that right now. It's a gift, or a curse, however you want to see it. Um, but clients will come in, they could be heavy, and I'll just feel it. And some of them don't, but you'll feel their energy even if they don't directly say it. So creating that environment, it starts with how we make people feel, warm greetings, genuine care, and active building trust, right? That all of those things that we do actively builds trust. So the physical environment matters. The physical environment matters too. So like your room cleanliness, um, the warm bed, the pillows, the blanket, the way the room smells, making sure that it's, pleasant, because not everybody likes lemon, even though you like lemon. Not everybody likes lemon. Not everybody likes grapefruit. So you want to make sure your room is pleasantly smelling. The treatment room is set up nice. It's warm and welcoming, and it's a place for clients to rest, rejuvenate, relax, recharge. And that peaceful environment also helps to regulate their nervous system, and it allows clients to actually relax. And also, in all of that, it's the client, the guest experience. So from the time they come in to the time they leave, right? It's the details matter, making sure from start to finish, and also educating your client, because education is empowering. When clients understand their skin and their treatment plan and realistic progress, it reduces anxiety and it helps them feel in control. I also believe in celebrating progress, not perfection. So helping clients to see improvements while reminding them their worth is not tied to flawless skin, but incredible healing. So that right there, it's everything. So it's the experience. And then us as estheticians having our knowledge, our education, and our expertise, we can share that with them. And then the humanist side, right? Being human, having compassion. So that's where it supports the client's mental and emotional well-being by making sure every detail matters in your treatment room, in how you produce yourself, how you conduct yourself, and how you make them feel.
Well said. I think that's what they always say. Take 10 minutes and pretend that you're the client. So you're laying down, looking around and seeing all of the things that you may notice. Since we're just there every single day to really make an effort. And then how you said progress, right? How sometimes you're not going to get results overnight, so that it's a journey. And that's why before and after photos are so important and being able to show them to stay committed. So, and in
Great.
addition to all the other details that you talked about, of course.
Absolutely. If for instance, if I have a client and we're going to do 8 treatments over a course of 8 months, or whatever the treatment, whatever we're doing, 3 months, some clients come into me every 2 weeks because we're doing more barrier building. They don't see the difference, but I always take pictures every time they come in. As soon as I do the first cleanse, I take pictures. And I have a folder. Thank God I went and got that 2 terabyte phone. So I got the new one that has 2 terabyte, right? Because I need the storage. But I take photos. Every time they come in, I take photos. And so, I don't want to say names, but I had just had a client last week. Brenda, I don't feel like this is really doing anything. And I'm like, look what we've done in the last 2 months. Look. And she's like, oh my gosh. So yes, taking photo and the skin games helped me do that. The skin games helped me to document my treatments. And so that was one of the things that it helped me sharpen my knowledge, and it helped me sharpen what I'm doing in the treatment room and being more aware, taking photos, documenting. So yeah, it's important.
Absolutely. Hey, Nichelle, quick question. Are you able to share with them the latest book that you published? Because I think that's an excellent resource.
Thank you so much. So my book is titled The Skin Remembers, and it's a corneotherapeutic approach to global majority skin. I would love to, have more people interested in the book club. So if you're wanting to know more about global majority skin or to hear, how to treat specifically melanin-rich skin, that book is available to you, and it's a great resource. Thanks so much for
Yeah,
asking.
just based on your first question that we asked and then kind of going into the corneotherapy of this next question, I thought that would be an excellent resource for them to be able to read. So your question, Nichelle, as a corneotherapist, how do you approach skin treatments in a way that respects both the biological integrity of the skin barrier and the emotional relationship patients have with their skin?
So I love this question because, as someone who has that nonprofit that is for people who, are meant to look at the whole person, that's how I approach skin. I don't separate the person from their skin. They're one system, right? So, I think as practitioners and as mentors, what we're supposed to do and help other people understand who are just coming up in aesthetics is that, our role is really to help in making our clients feel safe, so that they have, the ability to, experience care and they can feel represented in the treatment room. So what that can potentially look like is, seeing them accurately, making sure that you're using language that's, responsible, treating without, bias, any sort of way that you're putting together your consultation. Those types of things are things that you want to be mindful of, and just have an idea about the tone and what your signature is. So I think if you're someone who is interested in barrier repair, it's something that's not only biological, but it's also relational. It's something that you have to be really in tune with. Someone who's willing to survey the skin on a regular basis, because the skin is always communicating. The barrier is not something to fight. It's something that we should be understanding more. And I think that the industry is kind of leaning towards that now, getting a little bit more, you know, um, towards learning more about information and, what drives dysfunction and functionality and that sort of stuff, is what is coming more to the forefront. And I think that it's really important because, if we ignore the very basic parts, then we're not really setting our client up for success. And we're not allowing them to really have the ability to, gain results that can hold. So that's the reason why I love corneotherapy and why I feel like it's such a great philosophy, is because, you're starting from the very ground root of things, from the inside out, and not just addressing symptoms, but actually getting to the root cause of what the person's problem is, their condition, their issue, their concern. And you have the ability to, just really help them to get to a clinical endpoint. And I think that that ability to provide maintenance is something that we are all wanting, even as consumers ourselves. So yeah, if we're able to provide that, I think that that's something that most people are looking for. And if you're someone who wants to provide results and do it in a way that's ethical, um, you're wanting to also do it, with concerns for the barrier and making sure that you're not just going directly to correction without, you know, the understanding of things before you start.
Absolutely. And I'm not going to do any follow-ups only because I'm glad that we started early because we only have 8 minutes left to stay on schedule. So I want to make sure that Lisa and Elizabeth have plenty of time. So Lisa, I know that you're muted, but I'm going to ask you a question. How can dental professionals play a more active role in identifying signs of low self-confidence or anxiety in patients seeking aesthetic improvements?
Yes, I love this question so much. Tying into confidence and anxiety. And I think dental professionals are really uniquely positioned because we spend so much one-on-one time with patients and building long-term trust. So there's definitely signs that we, watch for, that I watch for. Um, patients that are apologizing for the way that their smile looks or how, my breath might smell or covering their mouth when they talk, speaking, negatively about their appearance, and then also seeking, extreme cosmetic procedures that, they aren't necessarily satisfied once they're, completed. So sometimes patients will ask us for whitening or aligners, other cosmetic improvements. And they're all in all really expressing, that fear of judgment, social anxiety, there's some insecurity there a lot of times. So our role isn't to diagnose mental health conditions, obviously, but to really create that safe space, like I was saying before. So one thing that I like to do is I throw in a little bit of motivational interviewing when I'm working with them. And I like to, ask them open-ended questions. So, what's motivating you to pursue this treatment? What changes are you hoping that this will bring to your life? Um, how long have you felt this way, about your smile? And it really opens things up because a lot of people, most of the time, go back to their childhood and actually, deep rooted things that have happened. And so it just really helps to connect us, but also give a better understanding of the goals and the emotions that are connected to everything. And, a lot of times kind of slowing things down and changing the recommendations, not just going full force and saying, okay, well, you want this, so let's do it. Um, and just really learning, more about the patient. It makes such a huge difference.
Yeah, those are excellent examples of how you're playing a more active role, and open-ended questions are wonderful. So thank you for sharing that. Okay, Elizabeth, in your integrative approach, how do you guide patients to shift from external beauty expectations towards a more self-accepting and pro-aging mindset?
This is such a good question. So really a lot of it is education and trying to help reframe their mindset, shifting, from correction to connection. And, clients are coming in and they're like wanting to fix. With the society that we live in, they're rooted in pressure and, comparison and unrealistic standards. So I just try to reframe skin as communication and not something to fight against. And I just try to educate them on internal factors, stress, emotions, lifestyle, mental health, how all of that can affect our skin. And I try to just kind of really slow down with my clients and create those intentional moments within the treatment room. So, breath work, stillness, awareness, anything, like we talked about earlier, Reiki, sound healing, anything to help them just feel safe and present in their body. And, reframing aging as a privilege, not a problem. And, of course, still offering corrective treatments, but from a place of care, not from a place of criticism for them. Um, moving from chasing this like unrealistic perfection that we see in the magazines and everywhere to just cultivating our own personal radiance, and then just the end result being just more confidence, empowerment, and just more alignment, really.
We truly are skin therapists, aren't we?
Yes. Yes, 100%. And it's just creating that safe, like a little bit like Brenda was saying too, like creating that safe space in the treatment room and really just allowing them to like open up and get to know them on a little bit deeper of a level. A lot of times when they do want, like, okay, make me look 10 years younger, or all these like crazy corrective treatments, it's like stemming from like a deeper rooted self-worth or self-confidence issue. And then, helping them slowly find ways to just, love themselves more and come home to themselves can help a lot with that. And then, yeah, if it needs to be a time where you need to refer someone out gently, to therapy or some other things, if they have something else going on, that might be appropriate too.
Mhm. Well said. And look at team, we are right on time. I would say I saw Brenda just entered hers, but for the rest of you, if you wanted to share your details in the chat, even some things that we brought up, maybe your website, Elizabeth, where they may incorporate the beautiful frequency, Michelle, how we talked about your book and some more information about IAC. I will share oncology aesthetics. Lisa would love to learn more about what you're doing. Like I said, I'm going to start following you. And Idalis is back, 11:55. We did it. So thank you all for being here today, and thank you for letting me moderate.
Thank you very much, everyone. We did on time. We was waiting with little bit for Brenda, but finally we get on time. Thank you, and just preparing yourself for October 17. Remember, you cannot miss this amazing celebration. Everyone, that day during the conference, both sign at a night the gala. So thank you very much, and we're going to continue with our schedule. And the next presentation, let's see the name, Despina. Despina, are you here? Yes.
Hola, Idalis. Hello, hello.
Hello, how are you, Despina?
I'm great, thank you. How are you?
Thank you. We're going to share a short video now, and then we're going to start with Despina.
Excellent.
I'm Idalis Bailey, best-selling author of Global Expert in Interior Beauty 1, 2, 3, and 4 edition in English and Spanish. I invite you to be part for the latest 5th edition on Global Expert in Interior Beauty. If you are ready to scale your name, your brand, and your expertise, this is the best space for you. If you want to be different in the industry and show all your community how important is your position, I'm waiting for you. Register yourself and be part of this amazing community. All right, we're ready. Despina, we wait for you for the Global Interior Beauty Conference like last year. So welcome, Despina.
Wonderful.
Despina,
welcome. Hello, hello. Thank you so much for having me. Just one moment here. All right. Well, Idalis, thank you so much to you and the amazing team at Global Integral Beauty for having me here. My name is Despina Freimanis. I'm here on behalf of Christine Valmy International School. So firstly, as I get started, before I start the presentation, I would like to first extend a sincere thank you to the people who have made this moment today happen, starting, of course, with Idalis Bailey and her amazing team at GIB, and also to my incredible team over at Christine Valmy under the great leadership of our current president, Gregory DeHaidu, as well as Marina Valmy, our Director of Innovation, Vanessa Maya, our Head of Education in Christine Valmy International School, New York, and also Assistant Director of the school, as well as Giovanna Navarro, our Assistant Director over at the School of Cosmetology at Christine Valmy in Wayne, New Jersey. And of course, the rest of our extended team at Christine Valmy for their ongoing support. And I'm here to really discuss the incredible contributions of this amazing institution and our ongoing legacy, that what makes Christine Valmy so integral to this platform as we move forward in this exciting industry of beauty. So Idalis, without further ado, I will go ahead and share my screen and get started. And I do open the floor also for any comments over in the chat. Happy to answer them or any other questions that you have. If we have any students present or prospective students, I do wish to encourage for all of our professionals here and for everyone joining us, if you also know of anyone who is interested or just has that passion, that spark for this industry and doesn't quite know where to begin, right? This is for them. And we hope that you will spread that love through our social media, through your social media, and as Idalis has been pointing out throughout the day, that we can raise each other towards greatness, because this industry is only growing, only expanding, and with so many regulations changing and so much discussion happening around where our future of this industry is headed, it's more important now than ever that we band together to really make sure that we can nurture the positivity of that future and where it's headed. So without further ado, I'll go ahead there, Idalis, and share my screen.
You have ready authorization.
All right. And I trust you can all see that right there.
Yes.
Okay. Well, welcome to Kristen Valming. We've been defining excellence in beauty education since 1965. And to quote a great in our industry, Joel Gerson, the author of the current Milady Standard Aesthetics textbook that is still used nationwide as the basis for that beauty education. If you're an esthetician, if you're a company that sells facial equipment, if you sell cosmetology textbooks, if you're the manager of a skincare salon, you have Miss Valmy to thank. Because of her, we have an industry. And this is Kristen Valmy, our pioneer of aesthetics, so that we can understand truly what we are all doing here in this platform today and why this conversation is so important. And these are essentially your 5 reasons why Kristen Valmy is the best in beauty education, ranging from our programs in cosmetology, aesthetics and skincare, barbering, nails, waxing, and makeup. Reason number 1, and the most important reason of all, is we essentially created the industry. We are all here essentially because of Christine Valmy. She is considered the mother of aesthetics and is credited by New York State Congress as such. She even coined the name aesthetics, from Greek for aesthetikos and French for esthéticienne. So before her, there was no education in skincare. There was no name for the industry that we're currently using today, that everybody's saying esthetician, esthetician. What does that mean? Kristen Valmy is credited with giving that name. She established the first and oldest aesthetic school in the United States. Before her, there was zero education for aesthetics. There was only cosmetology. And cosmetology at that time only covered something like 60 hours in aesthetics. And if I'm not mistaken, to this day, that hasn't really changed at all. But the basis for that education back then was not actually addressing skincare concerns, but rather covering them up with what they called cake up. If you recall that time, there might be some people here that do, because she was the first person to physically address how to truly care for the skin for the masses. She set licensing and professional standards, and she championed for this industry until it was recognized as its own profession in 1994, with its own license and the respect as an industry. We are 60 plus years later with an unmatched credibility in excellence in beauty education because our students learn from the source, the signature Kristen Valmy European facial massage, which many estheticians still use today and are highly coveted and sought after as facial massage techniques are concerned. They learn the foundations for skincare principles, client care, and communication, which is paramount to setting yourself up for success in this industry, as we've so dramatically learned today. They learn product and treatment recommendations and so much more. Under the current leadership of Gregory DeHaidu, our president, and Marina Valmy, our director of innovation, we have a lifetime of experience. We are female founded and family operated. So everything about those values and principles carries on today. And to talk to you a little bit more about the essentially influencer role Kristen Valmy continues to play. It's my pleasure to virtually introduce you to Marina Valmy, Kristen Valmy's daughter, and our current Director of Innovation.
My mother is the original person who coined the word skincare. She imported the first equipment from Europe to start doing facials with it. In 1965, she opened the school, was for the specific reason so that people would understand what is the proper skincare. In 1994, after 35 years that she tried very hard and she was going to Albany all the time, we actually changed the legislation to have an aesthetics license. And from us, from New York State, every single state afterwards, almost like a domino effect, started having an aesthetics license. She was called the mother of aesthetics because she was really the mother that founded this whole new field of skincare and of aesthetics. So we were the pioneers, and we still are the pioneers because we still believe in being on the cutting edge.
I always love hearing Marina Valmy speak because there's nothing like having it come from one of the original sources closest to home, right? About what makes us truly great and a legacy in beauty education, the beauty industry. Well, the second reason is we offer elite education and training to all of our students. We do this with an accredited curriculum. Very important that we are an accredited institution, both by COE and New York State BPSS. We keep that curriculum updated regularly with new trends and technologies. So our team of curriculum coordinators work diligently to update that curriculum for our students as the trends and technologies change, which is so important to stay on the cutting edge of exactly what is happening so that the material does not become dated. We also integrate within the curriculum product and ingredient knowledge, facial treatment protocol development, soft skill development, and so much more, all of which are paramount to setting students up for success. Because as I always say in the classroom as a skincare educator myself, is, doing a service is so much more than step one, step two, step three in the treatment room. So much more of what makes that experience what it is that you offer as a professional is how you go about that service, how you communicate with the client, how you kindly educate them and give them information to help them look and feel their best from the inside out. And so much of that is cultivated through your own sense of self and then learning professionally what else contributes to that success. And of course, once you have the tools to understand products and ingredient knowledge and formulation as well, well, then we train our students to essentially be prepared to work anywhere for any business and any beauty brand. We also teach on advanced modalities, so LED, microcurrent, ultrasound, galvanic, high frequency, and more. And we integrate those within our professional protocols as well. So they're not just learning textbook, they're learning hands-on because the way the curriculum is also designed is, as a hybrid curriculum, is half of the program happens for the New York school and in this case online, the other half in person. In New Jersey, it's in person only. And what the programs allow is components that are both theory and textbook integrated with practical theory and hands-on knowledge. So it's not just the textbook, it's then they get into their hands-on module and are able to apply that learning first to themselves as each other's models, and then secondly in the Spawn Clinic experience to outside clients who are paying clients who receive services by graduating students under the supervision of at least one instructor. So that in and of itself gives them also that real world training in an actual spa environment. So when they graduate, they have that leadership, they have that confidence and the experience to be ready for you, the professional, to take them on in your workplace. We also have a very uniquely positioned Pro in the Know series, where top beauty brands and beauty professionals come to us to train you, the student. So students get a first-hand look at professional networking, professional information and training and connection with the tools that are out there. So when they graduate, they have that in-depth knowledge already, that step forward to connecting with beauty professionals and setting themselves up for success past the traditional curriculum. We're also run by, I should say that we prepare our students for state board examination as well. So they're not just being prepared for the one end as far as industry goes, but of course to pass their state boards confidently and with flying colors. The third reason that Kristen Valmy is the best in beauty education is we have a top tier skincare suite of products that drives results. And why do they work? We're in a very, very rich industry with a plethora of products and technologies. And why do ours drive those results? Well, first, we were created over 80 years ago. So there is brand longevity. There's a power and intelligence in marrying science together with nature in our skincare brand. And through that longevity, well, as I always say, whoever is using Kristen Valmy and starts using it and sticks with it, you can usually see that through the skincare philosophy, which we'll hear more about in just a moment, why there's proof in the pudding, as I like to say. because they're powered by micronutrients that essentially work in harmony with supporting ingredients to optimize skin health. So essentially, the ingredients work together with the skin to allow the skin to correct itself and make its own changes. We can't change our skin, as you know. We need to work with it. And we've heard a lot of amazing professionals here talk about, set the expectation for the client. What do they want when they want an adjustment work or an enhancement done? Well, same is true in skincare. Skincare is a lifestyle. Essentially, it is a marathon, not a sprint. And so it's incredibly important to understand exactly how products can work with the skin. And we, of course, have the best of that knowledge because we're developed by estheticians for estheticians to deliver healthy, radiant, long-lasting results. To tell you a little bit more about the products as well, because who better to hear from than our very own Marina Valmy.
I believe that your skin should have its own glow and its own natural beauty, and that the natural beauty comes from a healthy, functioning skin. It doesn't matter your age, it doesn't matter your condition, but if your skin is functioning, your skin is going to look better. In the formulas, I go about it in a very different way than a regular chemist. I will always look for what conditions I would like to correct. I would look at what skin types and problems that I want to work with. And then I try to find the best possible ingredients that will work for that skin condition. My goal and my way of you working with the products is to make the skin feel almost like having chicken soup when you're sick, making your skin feel very relaxed and very good. And so the skin slowly starts to adjust and start to work differently and start to work and function efficiently. And that is when a good skincare product works well for the skin. What makes Christine Valmy products special is not just the way that we make the products, but the care and attention that we give to the products to make them work for the skin efficiently. My mother always said, and I believe that when you make something with love, it shows in the end results. So we are always making the Christine Valmy products with a lot of science, a lot of knowledge, and lots of love.
Isn't that the truth? All right. And so, of course, number 4, we also launch careers. And as we started off quoting Jill Gerson, right, we're all here essentially because of Kristen Valmy, because there's a good chance, as of all people, Idalis Bailey would know, we are highly sought after. And of course, there's a good chance that if you are that esthetician, you studied under somebody, under somebody, under somebody who studied almost directly next to Christine Valmy herself. Am I right? And so to help propel our students with that confidence and experience, we are connected to top spas and brands throughout, well, everywhere. We have a strong career services department. So we provide our students and connect our students with resume and interview support, job placement. We have our rockstar career advisor, Leandro Alvarez, who also helps coordinate job fairs and presence within the school as well. And through our Pro in the North series with our coordinator, Bianca Manole, that we're bringing the professionals to you while also showcasing our students to have that confidence to go forward in their job search, whether they wish to work first for someone else or begin to plant the seeds for their own businesses. And some of our top alumni, of course, aside from our very own Idalis Bailey, is Joanna Vargas of Joanna Vargas Salon in Manhattan. Sophie Pavitt, aka the Acne Whisperer, who is recently at our school as well to talk to our students. I hosted a panel with her as she shared her experience and how she got started in the industry when she graduated our program back in, I believe it was 2015. Desiree Dalia, it was lead esthetician for Augustina Spotter. We have Nick Lujan, a globally renowned makeup artist. Luz Cabrera, who is lead national trainer for Face Gem, and so many more. And lastly, you have career support for life. So once you're part of the Kristen Valmy family, you're a part of our family for life. All of our instructors are active industry experts in their craft and provide continual support for our students to help them any which way we can within the classroom. There's a family of support from enrollment to long after our students graduate so that we help our students every step of the way, from the moment they come to inquire about the school, to see our school, to enroll and begin the program. We are there every single step of the way. And if they decide to change their mind in a year, or they wish to pursue also nail specialty or Sedesco or iTech, we are there to help them. If they come back to us even 5 years from now and say, hey, you know what, I think I want to pivot in the industry, or I, lost my job, I'm looking to change, position someplace within our field, then we provide that guidance and support as well. We have an alumni portal of resources with ongoing industry news, job postings. We are a safe and inclusive environment, so everyone's welcome in our family if they want to learn and propel themselves in an exciting new career. We are here for them. There is also discounts and special pricing on advanced education seminars and professional and retail products, where our students and alumni are both privy to our wholesale pricing and retail pricing at 50% off once they enroll. So they don't need to show proof of licensure when opening up an account, or proof of licensure when registering for an advanced education seminar. In fact, they're allowed to register for advanced education seminars once they complete 450 hours of the 600-hour program in New York. That is huge. That means that before they officially graduate, they're already able to fill up their pockets with certificates in laser, microdermabrasion, chemical peel, alpha hydroxy acid treatments, and specialty care treatments, and oncology aesthetics, and so much more that we offer, including also brow beautification with our brow master Anazong, and so many professionals that come to teach on those specific topics, myself included. I teach gua sha and facial cupping, and ways that they can elevate their service. And they can do this without needing to have finished the program. Whereas other professionals, if let's say we have some individuals here who did not go to our school, if you did wish to, then we have to verify your professional licensure. And then of course, you're more than welcome to go ahead and take our advanced education as well for anyone here looking to advance themselves further. We do also offer spa ownership and management program. We do also offer ongoing education and international certifications with Sedesco and iTech. So the learning never ends, and we're here to support you every step of the way, with of course also unique access to industry opportunities within the field. If you're willing to start an exciting new career or take that first step towards turning your passion into a profession, you can choose from one of our 2 locations. We have our flagship in Times Square, New York, for our aesthetics, nails, waxing, and makeup program, as well as ongoing right now. We actually currently have Sedesco happening in our location as well. And then in our location in New Jersey, in Wayne, New Jersey, in the Willowbrook Mall, we are offering cosmetology, aesthetics, and barbering, and financial aid is available for select programs for those who qualify. So for any information on enrolling, class start dates, and so much more, please, you can find the information here to email, check on our website. We also have an amazing chatbot, Sophia, who is wonderfully knowledgeable and can usually give prospects the information they're looking for within seconds. So we can really help streamline that process, especially as we know that the Gen Z demographic really does want information now, and they want to connect, and they need that immediate attention. We are again ahead of the curve to offer that technology so that we can make sure to get all of those questions answered, generate those leads, and make sure that we can help them take their first steps to an exciting new career. And of course, age is just a number. So we know that education, my own students as well, anywhere from 17 to 65 and plus. We have students from all age groups, from everywhere, and it's just so exciting to be in a classroom as an educator, to bring this beauty education to so many people, because our craft, there is no ceiling. There is no ceiling to this craft. And to see more about what our students are doing in their exciting work, be sure to also follow us on social media at Christine Valmy, where we've also work really closely with Idalis, right, to promote this event. We've been so graciously honored last year and the previous year as well at your awards ceremony that you have always at the Marriott Marquis, Idalis. And we're just showcasing all the amazing things that our school and students and staff are doing to keep this industry moving forward and keep the legacy that is Kristen Valmy and beauty education going for the next 60 plus years. And so to leave you with one final quotation from Marina Valmy, in which other career can you have destiny in your own hands? Because certainly AI will not be interfering with our facials anytime soon. So thank you so much for having me here for this amazing opportunity to Idalis and Global Integral Beauty. And we thank you very much for being a part of the Kristen Family legacy and journey. Thank you to all the amazing professionals here for keeping that legacy alive, whether you matriculate with Kristen Family or elsewhere. Again, we are part of the future, and we're just happy to still be there for it.
Thank you, Despina. Thank you. Amazing, amazing presentation. I feel so proud of Christian Balmy because I went to get my esthetician license from Christian Balmy. It was in 2005. So thank God for that license. Today it helped me a lot to establish and building myself as a professional here. And I always just feel support from Christian Balmis with Global Interior Beauty. 3 years ago, I started to invite them and be part of this amazing conference. I feel so grateful that always we are together, support each other. Thank you, Despina. I appreciate. Say hello to Miss Marie in the night.
Absolutely will. Thank you always for your ongoing support, Idalis. We appreciate you.
Thank you. Thank you very much. We see you. We're going to see you on October 17th, remember. All right?
See you there.
What if your journey is already worthy of recognition?
I am the beginning. I recognize emerging talent. The passion that is making a difference. If you are rising, I am looking for you. I celebrate the harmony between science, wellness, and aesthetics. A holistic vision, professional ethics, the true meaning of integral beauty. I honor trajectory, leadership, and global impact. I don't just recognize success, I celebrate legacy.
I recognize those who transformed the industry. Those who left an unforgettable mark. Those who inspire generations.
Your story matters. Your work transforms lives. Your leadership deserves a stage. Apply today. The next story we reveal could be yours.
Hi, Linda. Welcome to Linda Tagliamonte. How are you, Linda?
Hi, everybody. Hi, Dallas.
How do you feel?
You know, I'm getting there. I'm still at home, in bed most of the time, but thank God here I am.
Thank you. Thank you for your time, and I appreciate your effort to be here as always support.
Absolutely.
Beauty, and today we invited you, Linda Tagliamonte, a licensed medical esthetician with so many years experience too, and also she is one of our leader and advisor board from Global Interior Beauty. So we are here to continue working together. So no matter what will happen, we always support each other. Welcome, Linda. Appreciate that you was not 100% feel good, but now you are making an effort, and it's part of our passion and our work. Welcome to your presentation, Linda.
Thank you, Dallas. And I know I tell you this all the time, but I truly appreciate you and all of your support and all of the friends that I've made from the Global Integral Beauty community. People have been checking in with me continuously, and it touches my heart so deeply. So thank you so much. So, this journey has been a little bit difficult lately. And I was going to do something different originally because, as you know, I last year became certified as a peptide coach, which I absolutely love. However, because of my situation of having pneumonia and COVID for it's going on a month, I thought I've been sitting in bed most of the time, and I thought, let me share some of my what they now call biohacking, little gadgets and devices and products that I love with you guys. So that's what I'm going to do. the first thing, these are not my usual glasses. These are blue light blocking glasses. I have fallen in love with these. I use them almost all the time. Not only when I'm on technology, but I've been using them in the office for the past few months with my clients, and I have no eye strain anymore. And I'm really surprised about that. So, blue light blocking glasses had become a main staple for me. So, that's these glasses that you see right here, and they protect our eyes from our technology, but they also ease the eye strain. So, I'm loving these a lot. So, as all of us, we're all searching for ways to better ourselves. But I will say that my personal biohacking came from a very deep personal need. Before there was a name, when I was very young, I would have very bad knots, debilitating knots. When I was a young girl, it wasn't until I was 30 that I was diagnosed with the term that they then used as fibromyalgia. So, from most of my life, I have been trying to find ways to manage the pain with my fibromyalgia. And ultimately, I came to find out from my acne struggle, it's all from the inflammation. So, because of my fibromyalgia, that's where my acne stemmed from. So it's always been a personal journey of me to deal with my aches and my knots. And this is where my biohacking comes in before there was even a term biohacking. And over the past year, exactly a year ago last week, my mom passed, and the grief has been hard on me. And I believe, and the doctors believe, this is where the pneumonia and the COVID, my body was worn down. So here I am. I'm actually sitting in my bed as we speak, and I'm going to share with you what I do. I don't have it turned on right now, but I'm sitting on my red light therapy mat, and we all know about the masks that we use. But I will tell you that the red light therapy mat, of course, it's so good for circulation, inflammation, aches, pains, lymphatic drainage as time goes on. So it's really, really helpful. So the first thing I'm going to show you, I'm going to do like a little show and tell. This little device, this is called the VIB, as you can see on the back. And this is a pulse. I've been using this for 8 months. And this is a pulsed electromagnetic field device. And what this does, I have it around my neck and I use it first thing in the morning. And our body runs on electromagnetic fields, but this kind of prompts our body along. And it has 60 modalities built into this little tiny device. And what I use it for when I first wake up, I use it on the mode. It's already built in. I don't know if you can see, and it's called Awaken. And then I push it and it starts. And I just keep it on around my neck. And this little tiny device helps to awaken my body. I can use it for acne. I can use it for sleep, 60 modalities. And what I'm going to share with you, this is really interesting. My little cat, she's with me almost constantly between my red light therapy mat and my pulsed electromagnetic field between allergy, inflammation. She actually lost all of her hair on her back legs. And with these devices, I have healed not just myself working on, but my little cat. So I swear by my little Vibe device and my red light therapy. So they're two key things that I use every day of my life. But I will tell you, when I get up in the morning, I scrape. I don't know if you guys are big with tongue scraping, but I scrape my tongue every morning. And then I use organic frankincense and I take my thumb and I put it on the roof of my mouth. And it has to be specific frankincense that is safe to ingest. But this is not only very calming, it's good for mood and it's good for immunity. So I keep this right next to my bed, this organic frankincense that's specifically for ingestion. And I calm myself and I get ready for the day and it also helps with immunity. So I love that. So after I do that, I go down and all day long I drink warm to hot water because it's very agreeable with the body and it's very good. It helps with constipation, hot water. It's good for all of our organs for digestion, but also relaxation. But what I also do with my hot water is I buy organic lemons and I clean them real good to get the wax off. And then what I do is I grate the entire lemon, the skin and the lemon. I grate it with a cheese grater and I keep it in a glass dish covered in the freezer. Excuse me. So every morning I take some of the grated lemon out of the freezer and I put it in hot water and it detoxifies our system. It clears mucus out of the system and it's very healthy for our insides. So that way we're getting the entire lemon, not just the inside of the lemon, but with the outside of the lemon too, the skin. We have to clean it, but it's very, very good for our system. So I'm big with that. And then I bring my hot water back up to the bed, and that's when I do my red light and I do my breath work. There's a doctor who I have followed for over 30 years. His name is Dr. Andrew Weil. And I learned breath work from him over 30 years ago, where we breathe in very slowly through our nose for a count of 4. We hold that for a count of 7 and then very slowly through our mouth, breathe out for a count of 8. And that relaxes our whole entire central nervous system. And I've done that for over 30 years. So that was part of my biohacking before there was even biohacking, thanks to Dr. Andrew Weil. And through Dr. Andrew Weil, I started drinking green tea when I was 18 years old. But when I was in my late 20s, Dr. Andrew Weil introduced me to ceremonial grade matcha. And I drink matcha every morning of my life. And it has to be ceremonial grade. And matcha is actually, green tea is wonderful for us, but we have to be very careful that if we get it in the bag form, that it's biodegradable and there are no plastics in it. And I'm drinking right now a brand Rishi, Rishi. And I love Rishi because not only is the tag biodegradable, no plastics involved at all, but also the bag is biodegradable. So it's very eco-friendly and it's important for our insides because we want to get rid of all of those plastics. So that is very, very big. So for a very long time, I exercise out of the bed. I'll get to that in a little bit. But I thought I spend a lot of time in the beginning of the morning in bed with my red light heating pad. I have a heating pad a lot for it helps with my knots and to ease into the day. But I thought, this was years ago too. I wonder if I could do some exercises in bed to kind of get me moving for the day. So I thought, how can I exercise and use a device that I can keep next to my bed? And I know that people, and this is very funny, my clients laugh about this, but I will take this into work and show them. I don't know if you can see this, but this is not the real one, but Suzanne Summers. This is called a thigh master that was used in between our legs to strengthen our thighs. And it's also very good to do Kegels for women, but I also use it for arm exercises. Every day I'm under the weather now, so I haven't been doing it. I'm going to get back into it hopefully in the next week or two. But I actually biohack and I use this thigh master in my bed to build my arm muscles. And it is extremely, extremely helpful. I have my weights, and I've been very big into light weightlifting for 32 years. But I will tell you, just using our own body's resistance, we can build a lot of muscle with this. So I use it for the biceps. I also use it below for the triceps, and I can do it behind for the shoulders. And this is amazing. I know it sounds crazy, but it is amazing. And the other thing, it's been around forever, and I'm on my fourth one now. It is called a neck slimmer. People don't believe me, but I'm 62 and my neck, I've lost a lot of weight from being sick. I've lost 15 pounds, but this is the neck slimmer. Now, this looks like a crazy little device. This device that works. It works to build the muscles to tighten our neck. And I actually do use this. I keep it actually right next to me in my bed. And this, if you do this every day, this builds the neck muscles and it truly, truly works. I have used this for well over 20 years. Like I said, I'm on my fourth one. So that is very, very interesting. And my son, my older son, he lived in Japan for 4 years and he was always trying to help me with my fibromyalgia. And he sent me this neatest device maybe 5 years ago. And this is a cupping device, but it's a red light rechargeable cupping device. And what this device does, this is absolutely amazing. I'm going to stick it on my chest and let's see if I can show you. And this device suctions to the chest. It's hard to see, but this device, if I have knots on my back, on my shoulders, on my leg, I put this device on and it's very soothing. It has heat in it. And this device will actually, it actually suctions and it releases the knots. And so this is the red light cupping device. I love, love, love that little device. And basically that's my morning bedtime routine. And then when I get out of bed, I I know that people talk about it now, but 15 years ago from Japan as well, I was introduced to whole body vibration platform, but by Dr. Fuji. Dr. Fuji was the creator of the whole body vibration platform. And it's good for people, even elderly people who cannot do normal exercises. You can sit on the vibration platform and stimulate lymphatic drainage and just build muscles. I taught myself, believe it or not, how to surf on a whole body vibration platform. So even if you can't get out and take a walk, if you're stuck in your house, or if you just want to ease into the day, the whole body vibration platform is very, very, very effective form of exercise. So I know that people think that it sounds a little bit funny, but I will tell you these gadgets truly work because I have been using these things for a very long time. So that's my morning routine before I even leave my bedroom. So I do a lot of little things that add up for health and well-being before I leave the bedroom. And so then, as I wind down for nighttime, I have biohacks that are very helpful at nighttime. I take a bath. I try to take a bath as often as I can because it's very healing to the body. And I love Epsom salt and lavender to soak in Epsom salt and lavender and a little baking soda. And that really eases the tension of the muscles. But while the body is wet, even before you get out of the bathtub, I love it's and this specific brand, it's from Amazon and it is not expensive. It's organic vegetable glycerin. And it is, I have tried everything on the market, every kind of lotion, oil, thick body cream. Organic vegetable glycerin has made my body softer than anything I have ever used. It's not expensive. It's on Amazon, but organic vegetable glycerin is a game changer as far as skin. For women, as we age, our skin can get a little bit crepey. The glycerin literally takes the crepiness away. And I have challenged so many of my clients to use this, and every single one now buys the vegetable or organic glycerin. So that's how much I love that. And then when I am done in the bath, I will show you one, but I've been wearing these for years, and a Chinese friend gave this to me. I was in my 30s, but this is a reflexology sandals, and these stones they're raised in the archway, they're raised at points, and they touch specific meridians on our body to heal. And when I tell you, if you walk in these, they can be very uncomfortable. So I tell people start with socks, but after a while, you train yourself and you wear these around for a little while, and it changes your life. These little hacks are little things, but they're ultimately big things, which leads me to my next, and this is probably my favorite out of every single thing that I do. This is an acupressure pen. I use this morning and night, and it stimulates. I feel it right now, but I use it with magnesium cream for feet. And this, if you roll this on the bottom of your feet, you can take care of a headache. You can take care of gut issues, constipation. If you have pain in your feet, this helps. But I use it more for pain throughout the body. And at the end of the day, working on people, this helps so much on the hands. So I'll put a little magnesium cream and I use this acupressure pen. And right now I don't have it. It goes all the way up to 9 and you feel this pen, but it releases the pressure on your body. And when I tell you this works, this is my favorite biohacking device ever, acupressure pen. And you can get these on Amazon for maybe 15 to $20. It's so well worth it. I love my pen. So that's a biggie. And I do that every night before I go to sleep. And then another thing that I love, and I'm going to turn it on now. I don't know if you can see the color a little bit, but I use an amber light when I am winding down. I turn technology off. I'm shutting off my pen. I turn technology off an hour before I go to sleep, and I write in my gratitude journal. I turn on just this little light. Here's the light. I clip it on and I turn this light and it really relaxes me and just eases me to turn down the day. And right before I write in my journal, I have started in the past 6 months taking saffron. Saffron is really up and coming for relaxation, anxiety, and sleep because I know a lot of us, I can't turn down my brain at nighttime, and people will tend to take Benadryl or things that are not healthy for us to take. I have been taking saffron and magnesium glycinate, and I do my breath work again. 4 breaths in, hold it for 7, 8 breaths out through our mouth. And I will tell you, these little hacks over time, these hacks have changed my life, little bit with each of them, but a lot altogether. And then when I sleep, I use bamboo sheets. They're very cooling, they're moisture wicking, they're antibacterial, antimicrobial. And I have my organic cotton pajamas. But what I love to do is we've all heard about eye masks to sleep. This is my favorite. This is a weighted eye mask and I put lavender on it. And even if we're on our side sleeping, this mask, it's just very lightly weighted. This does not come off. And I can use it sitting up as well. It has a little enclosure in the back. I love this weighted eye mask. It's called a Nod Pod. But this is really, really good. It's innovative. It's a little bit different than the regular eye mask, but I feel like the weight of it is very relaxing for eye strain. So I do that. I have my humidifier. I turn down the temperature to 66 degrees. I keep a snake plant next to my bed because it's very good for oxygen. It increases the oxygen level. And when we increase the oxygen level when we're sleeping, when we wake up, we're more energized. So, and an air purifier. So, all of these things that I incorporate into my daily life from morning when I get up, I open the blinds and I just, even though I'm not outside in the sun, my mom did this from when I was a little girl. Open the blinds and put your face out to the light to start your day and get your circadian rhythm into into where it should be to start your day. And then when it's time to go to sleep at night, you're situated. So all these little hacks from my life They help make my life better. So hopefully these little tidbits can help your life. You know, even if you take one or two from them, they can help you.
Thank you very much, Linda. I think that everything that you are doing is just to improve your quality of life, and there is no limit. And thank you to share your routine, but also where we can find that. I just suggest everyone who are here who are interested to buy some stuff of this for your skincare or also for daily routines, you can contact Linda directly to her social media. And also, you know, the idea is to educate and inform our patient too.
Yes, absolutely. Absolutely. I'm glad to share always.
Thank you, Linda. I appreciate your time. Either if you was a little bit like sick, also you was commitment to always support us.
Always, always. Thank you so much, Idalis. I appreciate you always.
We are in the last presentation, and just we're going to share one short video, and we have the last presentation that she's amazing too. Is a really good speaker. We are waiting for her now. The video is here. Thank you, Linda.
You're so welcome.
Thank you, thank you, thank you. We are here. Just Sheila is here. Just waiting for Sheila. This is the last presentation, and she is amazing. She is ready. Okay, let's go to do one other raffle and until she's connecting, okay? Because we are on time. We still have a couple minutes more. It's here. She's here. But let's do the raffle. I appreciate that you keep here after her presentation. It's going to be a couple minutes, no more than that. But we have the raffle for the ticket, the standard ticket for the conference on October 18. So that's the most important for today. Let's go. Let's go to see who can get the raffle. One now and one after Shayla too.
Ooh.
How are you?
I'm doing well. I'm excited. How is everybody?
Yes, we are happy to waiting for you. We are doing one raffle before you start and after. Felicia Medrano is here. Felicia is here. Felicia is here or no? Hi, Sheila. Felicia Medrano. Okay, let's do another more to see who is here. Top jumps. Top jumps. Okay, let's go to start with Sheila and then we can do another raffle.
Hello, everyone.
Nice.
How's everyone doing? I'm so excited to be in new spaces. New spaces are always so exciting. I see some familiar faces. I see Brenda over here. Okay, so let me go ahead and share my screen.
Yes.
Right.
Okay,
I
Sheila,
see.
first, I would like that you introduce yourself. I want to show everyone how how was our magic connection on that in Dallas, and also show us all your amazing work that you are doing.
Oh my goodness. Well, that is my first slide. So my name is Sheila Bella. I have been in the beauty industry now for since 2010, so 16 years, coming up on 16 years in September. I don't come from money. I didn't marry into money. And when I first started my beauty business, my entire goal was to make 6 figures. I thought, oh my goodness, if only I could make 6 figures, then I would be so set. I'd be so set. And, you know, I wanted to just be booked and busy. That's all I wanted. Turns out I was really good at marketing, even though I didn't go to college for it or anything, because as you guys know, marketing changes every single day. Every day it changes. It's almost like a good, the skeleton of marketing changes even almost every 3 months, it seems like. And so something that I felt like I was really good at is pattern recognition of what is happening in the industry now, how to get more leads into your business. And that's how I was able to do it. So since then, my business, I created a multi 7-figure beauty business under 3 years with one service that started out as only $300. So I had 2 locations in Beverly Hills as well as in North Hollywood. And I am so grateful to be a part of this because Dallas and I, we had a magical meeting in Dallas. And Dallas was just one of those places where I met so many incredible people at the Skin Games. And Idalis, you first met my COO, right? You first met Laura.
Yes.
And they had a connection. They're both from Colombia. And then so when I met Idalis, it was she was also on my podcast. She had so many amazing connections here in New York, and she invited me to this group. And she said that you guys have been meeting for a while, and I was just so amazed because that's always something that I wanted to do. I wanted community. I sought that out. And it is a really beautiful thing what she did for you, because as a leader, that's really difficult to do. You know what I'm saying? So I'm really grateful that you guys invited me here at the beauty seminar for Global Integral Beauty. And I believe it's your 7th year, right, Idalis?
Yes.
Yeah. So yeah, our meeting was, I felt like it was really divine, wouldn't you say?
Yes, it was a miracle. It was perfect for our connection. And
It
immediately when I just connected there, I told you, I want you to be part of Global Interior Beauty. I want you camp for October 17 in New York and all your stuff. So we are ready, waiting for you.
Okay, fantastic. Okay, and I know I'm on a time limit, and so that's why I am going to try and squeeze in as much information as possible. Let me see. If I share my screen though, it's okay, right? Because I know you guys, can you guys see my screen?
Yes, yes.
Okay. Okay, fantastic. So hello, everybody. My name is Sheila Bella. If you think I look good now, wait till you see me filtered and through Face App and everything and Facetune. Follow me on Instagram at Real Sheila Bella. You'll know a lot more about me. So my focus is sales psychology and premium positioning. We create luxury AI systems to help beauty professionals scale to multiple 7 figures, just like I did, just like our students have done. Collectively, we've generated over $100 million in student sales over the past few years, and we're so proud of the community we've built. So go ahead and give me a follow, and let's go on with it. So here's the thing. Today, I just want to address that feeling. If you've ever walked away from a consultation and thought, why didn't they book? Or worse, you gave them your price and they ghosted you. So this framework is exactly why that happened and exactly how to fix it. So what I'm about to teach you right now is called the respect method. It's a 7-step sales framework that I developed specifically for beauty entrepreneurs. But honestly, it works for any industry, med spa, but even if you're a stylist, a photographer, a coach, an esthetician, it doesn't matter. If you sell a service, this is for you. Here's the thing that I think most service providers get wrong before they even open their mouth. They show up to a consultation wanting to be chosen, And then second, you're in please pick me mode. You've already lost the sale if you're in that mode. So remember, you are not there to audition. You are there to assess whether they're the right fit for you. So that shift alone from applicant to advisor is what separates providers who are fully booked and raising their prices from the ones who keep discounting and wondering why. So today we're going to go through each letter here. R-E-S-P-E-C-T. Remember Aretha Franklin, may she rest in peace. R-E-S-P-E-C-T, right? The 7 steps. So by the end of this, you're going to have an actual script, real things you can say that move people from inquiry to yes without pressure, without chasing, and without even lowering your prices. Can you imagine that? All right, so here's the framework, the full framework at a glance, all 7 steps. And I want you to look at this before we go deep on each one, because I want you to understand something first. Most service providers are just winging it. They're just hoping the vibe is good, hoping that the client likes them, hoping the price doesn't scare them off, hoping. And then they're wondering why their closing rate looks like their bank account after Christmas. You know what I'm saying? Hope is not a strategy. This is a sales strategy. And single step in this framework has a purpose. It's not manipulation. It's not pressure. It's not that cheesy car dealership energy where someone traps you into a room until you sign something. This is leadership. So I kind of want to know in the chat, who here has a high ticket package? What's your highest ticket package? Tell me. Is it a laser package? It is a full body contour transformation package? Is it a BBL? Like, what is it? I want to see in the chat. This chat hasn't been going much, but I want to see. Tell me all your dirty secrets. I want to know, what is that one package you want to sell over and over again? I see some people looking, trying to type. Okay, while you type, I'm going to keep talking, and then I'll read some of them. So the first step is R, reset the frame. You take control before they even know what hit them. E, you establish authority. So when you open your mouth, they lean in instead of pushing back. S, seek the real problem, because what they say that they want and what they actually need are almost never the same thing. Let's not twist things off, right? P, present the right solution. One solution, not 5 different things, not a menu, one. E, eliminate objections calmly, confidently, without slashing your prices. C, confirm the decision. You actually ask for the sale. That's revolutionary. I know. What? Asking for a sale? That's so uncomfortable. And T, transfer ownership. You hand them the ball back and then you let go, because you don't chase. That's not who you are anymore. Okay, so let's break everything down. Remember, you're in a consultation. The first thing you do is reset the frame. And this one right here is where most of you are bleeding before your period even starts, before the consultation even starts. Here's what's happening. Client slides into your DMs. Maybe they found you on Instagram, maybe a friend referred them, whatever. And the moment they reach out, most providers immediately go into pitch mode. Here's my menu. Here's my prices. Here's my availability, right? Like, please book me, please book me, please book me. Just stop. You are not a vending machine. The frame, meaning who is in control of this conversation, who is leading, who is doing the assessing, that frame gets set in the first 60 seconds. And if you don't set it, then they will. And when you're sitting there answering their questions, defending your prices, justifying your experience, and wondering why it feels like a job interview you didn't apply for, yeah, that's why. You're not there to be chosen. You're there to decide if they're a good fit for you. That's a big, big difference. Because I think most providers feel like so lucky, like, oh my gosh, somebody's actually interested in my business. Like, stop. You have to reset that thinking. So say something like this when you open up. Let me ask you a few questions so I can recommend the best option for you. Walk me through what you're hoping to achieve. What does your ideal outcome actually look like? And listen, ask questions. Step 2 is to establish authority. And before anyone in the back starts squirming, right? Yes, I said authority. You are the expert. Are you not? Are you the expert? Let me know in the chat. Are you really the expert? Yes, you are. Own it, right? Because here's what I see constantly in this industry. Incredibly talented, deeply skilled professionals who spent years mastering their craft, and they show up to a consultation acting like they're not sure they deserve to be there. So establish authority. Say things like, based on what you're telling me, what I'd recommend is, let me tell you what I'd do if I were you. Let's seek the real problem. Uncover the true motivation behind the inquiry. This is where the magic actually lives, because here's what nobody tells you. People lie, not maliciously, not on purpose, that they walk in telling you what they think they want. And it almost never, never is the real thing driving the decision. So find out, what is that driver? What made you start looking into this now? What's been frustrating about your current situation? What would a truly successful outcome look like for you? So you're seeking the real problem. Next one is P, present the right solution. So present the right solution. And I need you to pay very close attention here, because this is where I see the most self-sabotage happening, bar none. You've done the hard work. You've reset the frame. You established your authority. You dug deep and you found out what's really going on with this person. You have everything they need, and then you blow it. You open your mouth and you say, well, there's option A, there's option B. Then if your budget is a concern, we have option C. No, present the right solution. And it's typically your full package. So say something like, based on what you told me, this is what I'd recommend. Given everything you shared, this package is the only one for you. The only one for you. Next, eliminate objections, because you know they're going to have some stuff. They're going to have some things. They're like, it's not the right time. That's expensive. I found someone cheaper. I need to think about it. This is when the call actually starts. If they say that's expensive, say compared to what? If they say I need to think about it, say, of course. Well, what specifically do you need to think through? If they say I found someone cheaper, you say, what's the difference between what they're offering and what you're looking for? What is it? Eliminate the objection. Then C is confirm the decision. Ask directly. As soon as you eliminate the objections, then you ask for the sale. Say, how would you like to move forward with this? Let's go ahead and secure your spot. I have availability right now. Do you want to lock it in? Ask. And the last slide is transfer ownership. You are not responsible for their decision. You're responsible for presenting the opportunity. That's all you are, clearly. And then release the outcome. Hold the standard. You close and then you let go. That's the posture, right? Honestly, this is the one that requires the most growth, because this is the one, this is about who you've decided to be. You've done everything right. You reset the frame. You showed up as the expert. You found the real problem. You made one problem. You made one clear recommendation. You pitched one package. You handled objections without flinching. You asked directly for the sale, right? But you need to transfer the ownership. Like, this is your moment. My skin doesn't change. My body doesn't change. This is your moment. What are you going to do, Samantha? What are you going to do? So remember the core beliefs. You don't chase, you lead. You don't negotiate your worth, you diagnose. You don't over-explain your price, you recommend. You don't rely on pressure, you present the opportunity, and you close with clarity. That is the mindset. So the RESPECT method, RESPECT, find out what that means to me. You lead, you diagnose, you recommend, and you close with clarity. Any questions? If you have any questions, you can actually DM me at Real Sheila Bella.
This presentation is very short, but is quality of content. I told everyone that with your program is going to help us to grow our clinic, our service, our products, because you have so many experience in that. So I also would love to invite you to be part of the Global Integral Beauty on October 17th, because of course you're going to have a little bit more time. It's going to be better to have you close and just you can share us like all the program.
Mm.
That's that's the real part of the work that we're looking for, because everyone is ready to grow. But sometimes we don't know how. We don't know who is the correct or the good person who have already the good experience, who can share and we can educate us how we can do that. So it is very important to know a little bit more how we can work, how long is your program, do you have any different package, how just give a little introduction, how we can start.
Great question, Italy. So right now, it starts with a conversation. So I encourage you guys to message me on Instagram, because we can do a lot of things for you. We can run your ads, we can do your website, we can help you with your organic content, help you get more followers with better organic content. We can also give you sales strategies, just like what I gave you, and coach you. We can even help you coach your team. If you have a front desk person and all she's doing is getting Voss water all day and checking people in and answering the phone, trust me, there's so many more things that she could be doing that's revenue generating. And if you haven't had formal training for a med spa or a clinic in the business side for 2026, 2027, I provide that. And also, we install AI systems and automations so that your business just keeps getting leads on autopilot without you having to lift a finger. It's basically a complete system, the full complete system. But in order to find out what that is, we need to have a conversation first, and we need to diagnose your specific business. If you're running ads right now and your ads are working great, then you don't need ads. If you're running ads and it's not working great, let's find out why. And I'm not saying you need to fire your ads guy. Maybe we can take a look and see if there's something that he or she could be doing better. Maybe your organic content, you're posting all the time, but it's not bringing in leads. So the first step is really to diagnose your business first. I mean, a lot of you guys are in the medical field. You know, you can't just give a prescription without a diagnosis first. And that's why what we do is very loving. I promise you, it's very custom. And it's also very we don't just throw a bunch of pills, essentially a bunch of prescriptions at a sickness. We have to maybe fix the lifestyle first. There's a lot of parallels. Maybe we need to fix your diet. Maybe we need to fix something with your manpower, your team internally. So that's how it works, Idalis. I hope I answered your question.
Yes, definitely yes. So we are doing every month networking also in English and in Spanish. This is a seminar. We do 2 seminars in English, 2 in Spanish during whole year. And then we do monthly networking. So the idea is to educate all the global integral beauty community to learn from this and decided to start to work all together and grow all together. And remember, the idea is everyone who have their entrepreneurs, who have their clinic, is necessary to learn from experts, because that's the only way to grow. So that's the part that we try to help everyone, so it can get the benefit for them, it can get benefit for you, it can get the benefit for the community too. So everyone is going to win. So that's the idea. We're going to invite you later again for the networking too, and also for the conference. You are ready. If you have any additional question from this group, because we started at 9 o'clock, people are tired too. I'm tired too. So whole day we was sitting here. So
wow.
If you have any additional question, so I have one extra question. What is the social media recommendation from your experience, TikTok, Instagram, or Facebook, or it is depend of the age community, or it's depend of the age community, no?
So people on Facebook typically have more money because they're a little bit older. People on Instagram as well. I think Instagram's a great platform to run ads and to do organic content. TikTok is changing. TikTok is not what it used to be. If you have a product to sell, I think TikTok is a great place to be, but it's not what it used to be. So I do think the money right now is in Meta, which is Facebook and Instagram.
Okay, perfect. Now, how about LinkedIn?
LinkedIn is good for professional networking. Like, for example, if you sell products or machines, perhaps, I think that's a good place to start. And it's good for professional networking. But in terms of like finding clients, it's harder to scale.
Perfect. That's a really good, because as everyone know, either if we are in the social media, if we are not open for the new trending, the new AI, because there are so many things every single day. So at least try to be a little bit update if we are not doing everything, but we have to be part, and especially with this network connecting with everyone's and be update with you have amazing experience with that. That's why I love when I meet you in Dallas. So definitely we have to invite you to do that, to do more training, and just specialize for one networking, Sheila.
I would love that. I love people and meeting new people.
Okay. And also we invite everyone to follow Sheila, especially that she have a really good podcast. So that's part of the aesthetic community too. Welcome to Global Integral Beauty Community, Sheila.
Thank you. Thank you. It's a privilege and an honor. Thank you so much.
Okay, so everyone who are connecting, remember we are going to do the last raffle. We're going to give away one standard ticket for the conference. The conference is going to be $99. Everyone who want to buy just special tickets until this weekend is open just for $99. The regular ticket VIP that include breakfast, lunch, book lunch, everything is 750. Remember, in the Mario Marquez Hotel. VIP number one is going to be the Luxury Award at night. Beautiful conference, but only who are ready to buy it this weekend is $99. So let's do the last raffle. Luis, please, could you put the names? All right. Good luck.
Here we go.
Good luck. Who is this? Dante Lindsay is here? No, I don't think that is here. You can, no, it's not here. You can do the second one. It's just only who are here. Jessica, no, it's not here. Let's do two more fast. No, it's not here. Everyone starting the mornings was connecting from early time. And the last one, Felicia Medrano is here. No, I don't think. I saw early. I saw her. All of them was connecting early. So the idea is only for person who are connecting now. So I really appreciate everyone for your time, Sheila, for your time too. Remember, very important, continue, just share your stories with your presentation today. We're going to follow you. We're going to do the testimonial directly from global to you, to it who have the Google My Business. We're going to write a testimonial. You can write another testimonial for us, and we can continue working all together. Thank you, everyone, for this amazing time. It was very hard day from 9 in the morning. All the presentation was amazing. Thank you, thank you, thank you. Have a wonderful afternoon, and we will see you at the end of the month for the networking. At the end of May, the next networking is going to be about hormonal, menopause and hormonal for May 30. Thank you very much. Thank you, Sheila. Thank you, everyone who was connecting today. Despina, Amy, Diana. Thank you, Diana. Thank you, Lenny. Thank you, Nichelle, Brenda, Brooke, all that who was connecting today. Thank you, Adela. Thank you very much. Thank you, Dr. Stewart, Dr. Lana. Everyone was connecting today. Thank you. I appreciate your support and your time. Thank you for my team that without them we cannot do anything. Thank you for everyone who are working here together. Thank you.
Everyone.
Thank you. Good afternoon for everyone.